Dr. Rajan, are you there?
Governor, sir, are you there?
I'm here.
Morning, ma'am.
Hi.
Hi, ma'am. It's me, Dr. Rajan here, madam. Welcome to our conference, ma'am. Organization Secretary. Governor, sir. Dr. Gobinath.
Yes.
We are just checking the team, ma'am.
So we can start, sir. A very pleasant morning to all delegates, chairpersons, judges, and invited speakers. I am delighted to welcome you all on this drizzling day 3 of scientific talk of a successful international conference BMSCon 2021. Learning is a continuous process and lifelong process. We here as professionals are really passionate to have our learning process continuing. So on this day 3, I would like to invite our guest speaker, invited speaker, Dr. Barbara Goodman. For her talk, I'd like to invite our chairpersons to invite. Let me introduce the chairpersons, then you can share. For this first talk, we have two chairpersons. Our first chairperson is Dr. V. Suganti, currently working as Professor and Head Department of Physiology, Vinayak Mission Kirbananda Warrior Medical College, Salem. Madam did her MBBS from Coimbatore Medical College, MD Physiology from Christian Medical College, Vellore. She has vast experience of 16 years of UG teaching experience and PG teaching experience. She is presently Executive Editor in the National Journal of Basic Medical Sciences, member and resource person in the Institute Medical Education Unit, has completed ACME course. She is currently NAC Steering Committee member of the Institute. She has 23 purpose in physiology related medical education related topics. At present, she is guiding 7 PhD scholars in BMRF deemed to be university, authored 1 physiology textbook and co-authored a textbook in physiology. Thank you for coming as chairperson. And next chairperson is Dr. Pravati Pal, my teacher, my mentor, Professor and HOD, Department of Physiology, JIPMER, Pondicherry. Madam is working as Professor Head, Department of Physiology, JIPMER presently. Her field of research is electrophysiology, endocrine physiology, cardiovascular physiology, yoga, neurophysiology. She has research publications of around 130. She has membership of national and international organizations, and currently she is guiding many MD students and PhD students, and she has awards and memberships to her credit. Title of MA BMS from Indian Association of Biomedical Scientists, Vaithilingam Venkata Subba Reddy Gold Medal from Pondicherry University for the year 1998. She has received Gauri Shankar Memorial Award for Utkal Bangya Association, Dr. N. Batnaban Memorial Award from Indian Association of Biomedical Scientists for the year 1998, Niranja Bishnupriya Award from Association of Physiologists of Orissa, Professor K.P. Putraya Award for Best Teacher in Physiology from APPI, A.V. Tilak Parvati Devi Prize for Best Paper in Endocrinology and Neuroendocrinology from Association of Physiologists and Pharmacologists of India for the year 2016. We warmly welcome you, ma'am. Over to you, ma'am. Please take over the screen and then please introduce our speaker. Thank you.
Thank you, Dr. Gopinath. First, greetings to all. And I thank Dr. Lakshmi for giving me this opportunity to chair this prestigious session along with Dr. Suganti. It is my pleasure to introduce our speaker, Dr. Barbara Goodman, who is currently Professor of Physiology. Dr. Barbara started her career after obtaining degree in chemistry, and then she completed her PhD in 1980 in physiology and her postdoc in pulmonary research in 1986. Starting her career from 1972, she has been in various positions, being research assistant, then assistant professor, associate professor, director of ST INBRE, and presently she is full professor from 2004 onwards. To speak few lines about her achievements, one of the notable achievement is she is the originator of the application for SD-PRIN INBRE and has served as the principal investigator and director of the program since 2001. The program is now in its 20th year of funding. And for your information, the program supports research endeavors of faculty and undergraduate students at 7 predominantly undergraduate institutions or tribal colleges throughout South Dakota, in addition to building biomedical research infrastructure in proteomics, bioinformatics, and nucleic acid sequencing and genotype for researchers throughout South Dakota, the region, and the IDA program. She is active in the American Physiological Society, having served on its communications, education, and public policy committees. And she has been an elected member of the APS Council, formerly chair of the teaching section and the chair of the communications committee. She is a fellow of the American Physiological Society and presently editor-in-chief for Advances in Physiology Education. She has got various honors, but the extra one, what I have not told, is she is the winner of Arthur C. Guyton Physiology Educator of the Year from American Physiological Society in 2011, Claude Bernard Distinguished Lecturer of the Teaching Section in 2016. She has many papers to her credit. One is in Physiology of Exercise and Inquiry-Based Science module for middle school students, which was published in American Physiological Society in 1990. And this paper is published and to be distributed nationally, both in hard copy and on the APS website. When I look at her research publications, she has published a paper named CFTR in Cystic Fibrosis and Cholera from Membrane Transport to Clinical Practice, which was published in Advances in Physiology Education in 2005. Also, membrane transport in cystic fibrosis, channels active in excitability of nerves and skeletal muscles across the neuromuscular junction, basic function and pathophysiology. She has many publications in education. Just to name few, the development and implementation of a new medical biology measure, including physiology. This was published in 2015. And very interestingly, this title, From Lemons to Lemonade, Pandemic Adaptations Expand Physiology Educators Community Outreach, which is going to be published in Advances in Physiology Education as an editorial shortly. So I will recommend to all our reviewers and audience to go through this paper once it is published. With these few words, I welcome Dr. Barbara, who affectionately likes to be called as Bob. So without let us listen to her for today's talk. Welcome.
Okay, can you see my slides appropriately?
Yes, ma'am.
Okay. I'm not an endocrine physiologist. I'm actually a respiratory physiologist. But when the people in charge of this conference asked me to do something specific, I thought that I could use this as an example of how I design a course and the kinds of things that I use in my course for team-based learning and for student-centered learning. And so I'm doing endocrine physiology because I had some nice examples to include. So in this case, then I'm going to tell you a little bit about this course, if I can figure out how to advance the slides. Okay, so this course was actually designed, I have a paper actually in Advances in Physiology Education for occupational therapy doctoral students. And in case you don't know what that program is like in the United States, it's a doctoral program, so they've had 4 years of college already. And when they were undergraduate students, they had to take a lower level anatomy and physiology course sequence. And this course is part of their career and certification exam training to be occupational therapists. When I first started teaching this course, I really didn't know what an occupational therapist did or what they needed to know about physiology. So for each of the sections that I'm using in teaching the course, I use a background knowledge probe. And I've given you the reference on the top of the slide. It's from Classroom Assessment Techniques by Angelo and Cross. And what I do is I ask questions about topics that I think are relevant in that particular system that we're studying, in this case, endocrine. And so this is an example of the kinds of questions and answers I would give. Peptide or protein hormones, and the answers are always the same. Have never heard of them, have heard of them but never really knew what they do, have heard of them and could have explained once but cannot recall now, can recall what they are and can explain in general terms but not how they work, and can recall what they are and can explain how they work. Remember, these students have had a lower level anatomy and physiology course 4 to 6 years earlier. So I'm trying to find out what they remember. And that was not the slide. So the other kinds of questions that I asked, the other topics besides protein and peptide hormones, were steroid hormones, amino acid hormones, same answers, anterior versus posterior pituitary gland, hypothalamus, adrenal glucocorticoids versus mineralocorticoids, thyroid hormone, regulation of plasma calcium levels, growth hormone, and insulin versus glucagon. And I chose those topics. So you could easily choose whatever topics that you're planning on discussing in your course and have them write answers that tell what their level of knowledge and understanding is. And so I do that with each section as we get in, because I get new students every fall. The other kinds of things that I do with the students is I do a lot of student-centered activities during class. And so here are some of them. Some of them are just plain old think, pair, shares, and I know you know about them. But this is one specifically from endocrine. Discuss the ethical differences between giving someone growth hormone because their child is expected to be very short, as opposed to someone giving growth hormone to their child because they want to raise a basketball star. And so I have them discuss that, and then we talk about that as a class. Or if a person's diet is low in iodine, predict what happens to thyroxine production. After we've seen a slide that says how thyroxine is made, what functions in the body would be affected. And so that's another think, pair, share. And with think, pair, shares, you really do need to give them a little bit of time to actually think before they have to pair or talk with their neighbors, and then we share as a class, because some students need time to think. They can't just automatically off the cuff say something without thinking about it. So I usually time for 30 seconds to be sure they get a chance to think. So that's easy to do during the lecture. We also do a lot of case studies during the lectures related to slides. This particular case study, I use Silverthorne, D. Silverthorne's book, which many of you know and probably know Dr. Silverthorne too. In every book, she has a case study. So this is one from her chapter 6, and it's Marvin Garcia, who has diabetes, doesn't know what it is, even though his father had diabetes. And so we use that case study during the lecture to talk about the situation that he's faced with and the questions that he's asking. The other kinds of things that you can do in a classroom setting is give some assigned readings. It could even be news that's happening about a new drug or something before class, and then have the students come to class and discuss that. So as long as they're in their teams, they don't feel upset if they have to actually volunteer answers, because their teams give them that sense of security. And if you were actually not in a face-to-face setting, you could easily do this in Zoom breakout rooms too, because they would have the security of talking with their teams. And so that's what I do. I actually call on the teams randomly after they've had a chance to discuss things, or I could in advance actually choose a team and say, you're going to lead the discussion this day on this particular topic related to the meetings that they've been assigned. The other thing that we do is, in order for them to review and remember, these students probably don't remember their physiology from 6 years ago, I have them review the chapters in the textbook. And they take an individual multiple choice quiz with the main topics, which I've actually designed. I give them, learning objectives for the particular chapters. And so the questions that I ask are based on the learning objectives. So they do an individual multiple choice quiz, and then they immediately take the same quiz with their classmates. And the quiz has 10 points for an individual and 40 points for the team. So they have to come up with consensus answers with their classmates. What I've done with my occupational therapy students is, instead of me writing the multiple choice quizzes, because of the fact that, as I said, their knowledge is not on the tip of their tongues, they do not remember their physiology from 6 years ago, I actually have the teams write the quiz questions based on the learning objectives. And so they get about an extra week or two to write their quiz questions. Each of the teams turns them in. I had 8 teams this semester, so I had 80 questions to choose from. I chose 10 questions from the team written questions and gave them that as the quizzes. And they did much better by being able to do that. And they had a chance to discuss the questions and relearn or learn the material while they were designing their quizzes, which I thought was a great idea. And I've done it now for 2 years in a row, and I think I'm going to continue doing it with that class. I don't do it with my advanced human phys class, who are undergraduates who've already had a 400 level physiology course, but I do it with these students who don't know or remember their physiology. The other kinds of things we do in the class is we do a lot of human physiology experiments. We use AD Instruments LT platform. And so we try to do the experiments that things like pulmonary function tests, EKGs, galvanic skin responses. They can make measurements on themselves as normal, healthy people, I hope. There's a glucose absorption laboratory that we do for the endocrine section. And instead of actually having them drink certain compounds and measuring the glucose in their urine over the 3-hour lab, which even before COVID, we didn't like students handling urine, we actually use the data that AD Instruments gives out that tells about glucose absorption. So we don't actually make them drink and pee to make the measurements. But there is a lovely case study for Mrs. Campbell, who has type 1 diabetes mellitus. And she does a nice job talking about how she manages her blood glucose levels. So I use that case study with them during the endocrine block. The other thing we do during the endocrine block is that you may be aware that Advances in Physiology Education has for a very long time had papers that had different kinds of laboratories in them. And Dr. Steve DiCarlo, who's at Michigan State University, had a bunch of his graduate students wrote papers about virtual rat experiments. So these are experiments that use hypothetical rats and take measurements. So there's at least 2 of them. There's a gastrointestinal one and there's an endocrine one. And so you can just have the students go directly to Advances, which is always free online, and they can do the experiment with virtual rats to learn about the concepts of endocrine physiology. It's a dry lab. There aren't any real animals. When I was a graduate student, I actually did a similar experiment with rats, real live rats, but this one is virtual rats, and they learn the concepts of endocrine from doing that experiment. These are the other kinds of things that we're doing in this class, is that we're doing a lot of cases. And one of the cases that we are doing, the one at the top, Bathsheba, is a case, I'll tell you a little bit more about her in the next couple of slides, but it's a case that I wrote up based on a previous student who came up to me, and it's published at LifeSci TRC, which is the resources for teaching from the American Physiological Society. So it's free there at that site. And then I have 2 other cases, which I'll show you a little bit about. These cases were actually written by a previous advanced human physiology class, which was an undergraduate class. There were a few students in the class, I think maybe 3 or 4, And so I had them write 2 case studies because I was just getting ready to teach occupational therapy students, and I wanted to have some case studies that were relevant to them. And so my students, my undergraduate students, wrote these case studies so that my graduate students would have something to do when I was teaching them later on. So here's the case of Bathsheba. She's a young woman with a germinoma, which is a very strange kind of a cancer to have in the pituitary gland. But it led to the destruction of her pituitary gland when she was 12 years old. They had to destroy the germinoma, and they destroyed the gland at the same time. And so the questions that are asked about her is how does it affect her growth and development? How does she react to the hypothyroidism, and can you do anything about it? What about the hypocortisolism, and can you do anything about it? What about having a future pregnancy? Should she be advised to have one or not have one? And what artificial hormones are available and easy to use, and how long in her life would she be able to do that? She came and told me about this when she was in my biology class a number of years ago. Now she's in her 30s and is married and is a nurse. She does not have children, but she gave me a lot of information about her situation that we use in this case study, which is available online for anybody to use. Then my students also made up a case for Michael Smith. And these are the kinds of questions that they asked in the case for Michael Smith. To describe his disorder, he's an achondroplastic dwarf. Why the skull bones were not affected by the genetic mutation, the consequences of amino acid substitution that caused the problem. And because they're occupational therapists, whenever I have them do anything that relates to a person, I have them tell me how an occupational therapist would respond in this situation and what kinds of things an occupational therapist should do with that kind of a patient. And so they have to talk about the implications for occupational therapists. Then this is the other case study. Obviously, John Hancock is a fake name of American history, so not that little boy. But this one, it's a child who has too much growth hormone. And so they have to ask about the growth hormone, the blood sample, how you take a blood sample. Can you take a one-shot deal, or do you need to take it over time? Why did the doctor administer glucose? And it has to do with the sodium potassium ATPase and energy levels. How the tumor from the pituitary might cause this particular problem that he has, which is excess growth hormone. Consequences of pituitary surgery, consequences of pediatric onset of gigantism as opposed to adult onset, and the normal tasks that would be impacted that occupational therapists would need to help him with. So that's John Hancock. So these are some of the places where you can get really good case studies to use with your students. You can have them write their own, or you can actually go to the National Center for Case Study Teaching and Science, and that's the link for that. The author of that center, which has been around for a very long time, actually recently published a paper in Advances in Physiology Education where he evaluated the use of that website and the use of his cases and using the data from the website. I use AD Instruments and their LT online case studies. You do during the initial part of the pandemic, they actually provided their accesses for free to physiologists to use. Right now, I'm actually using it with my students to have access, and we pay for that at the university. And then Dr. Silverthorne's Human Physiology and Integrated Approach book has case studies in it, as I mentioned earlier. So those are some case-based learning resources that are free or easy to find. So what other kinds of things can you do if you're not talking about just doing something one day? And one of the things that I have my students do is they design a project. And so it's a presentation and these are the occupational therapy students, they choose something that we either didn't cover well enough that they think we should have, or a case, a disease that they want their classmates to know about. And with the occupational therapy students, I made them actually include an interactive component. Occupational therapists work with patients to help them feel comfortable and be able to do things better, but they have to be creative. And so in order for them to be creative, I wanted them to figure out a way to interact with the rest of their class as they were teaching them something in a creative and fun way. And then in their projects, they also have to say how the occupational therapist would relate to that patient. They could design and present their own case study if they wanted to. And at the initial part of the lab, when we were first starting the course, they actually did peripheral nerve function and skeletal muscle function experiments from AD instruments. And then they prepared a scientific poster about their experiments. And we had a poster session where they had to present their poster to their classmates, to the previous classmates, and to the faculty in occupational therapy. So for them, for most of them, it was the first time they had ever done a scientific poster presentation. And it was a great way for them to actually review what they had done in the lab and learn how to be a professional making a presentation. And those kinds of poster presentations can be done by video. In my other job as the director of the IDEA program, the INBRI program, we've switched to video poster presentations during COVID, and they can easily be done by video. So that with questions. So these were recently, this class who's still meeting until next week or the week after, these were the recent examples that they chose to make presentations on. Hormone replacement therapy, hyperthyroidism, endocrine disorders, that was a general one, Cushing syndrome, posterior pituitary dysfunction, Hashimoto's disease, gigantism, and then one group did a wonderful review of endocrine and different hormones and situations about those hormones, which fortunately was the last presentation. So I got to bring all of our minds back to what we were supposed to be learning. And these were the fun things that they added to it. I thought they were very creative because I have 8 teams in this class and all 8 of them chose something different. There's only 7 things listed there, but they chose something different for the interactive part. They used games that are online games that you can see in the United States. I'm not sure you can see all of them in every other country. I know you probably have access to Kahoot, but these were TV games, Wheel of Fortune and Jeopardy. But basically they chose those games and actually designed reviews and fun things for the other students as part of their interactivities. I thought they were very creative when they did that. So what kinds of places can one go for ideas for resources for teaching? Well, there's the Life Science Teaching Resource Community, which is sponsored by the American Physiological Society, and that's the link. That's where some of those cases were found. There's plenty of other cases. There's lots of resources there, and it's free. If you make it to a professional meeting that has teaching posters or sessions, then you can participate in those. The American Physiological Society has an Institute on Teaching and Learning, which is offered every 2 years. The one in 2020 was changed into a virtual meeting because of the pandemic, but the one in 2022 is going to be face-to-face. It's a 3 or 4 day meeting, and it's great for getting around and talking with other people that are interested in education. Unfortunately, we do not have access to funds to support international educators to attend the meeting. So if you just happen to be coming to the United States, come in June and come to our meeting. Then we also have something called the Physiology Educators Community of Practice, and I will actually show you that in a minute. But it's a blog written by physiology educators around the world, and I'd love to have more people. So please let me know if you're interested. barb.goodman@usd.edu. I'm the organizer. It's free and it's online. And about every 2 weeks, we have someone actually post something on our blog. And then, of course, I'm the editor-in-chief of Advances of Physiology Education, which is a journal that publishes articles of various levels. Some are just illuminations where you explain how you teach a certain concept. Some are real educational research, and there's all kinds of things in between. So how do we assess things with this class of students? How do I get points for them so they can get a grade in the course? Well, they have the readiness assessment quizzes, which we always also said was 50 points, but they have individual take-home essay exams that have a lot of clinical questions on them. I let them use whatever resources they want, but they have to do it as an individual, and those are worth 50 points. And then they do team in-class exams that are mostly multiple choice and maybe short essay questions. So once again, they're working with their team to discuss things, to learn from each other, to interact with each other and come up with consensus answers. And then the team projects, I can't figure out a way to take off points for a team project. So they get points for having done the team project and being there to present. And the occupational therapy students have required attendance, which is not true of all classes in the United States. So it is lovely that they're always there and always doing their work. So here's how to join the Physiology Educators Community of Practice, PCOP. It's free. You go to the LifeSci TRC under community and just sign up for it, and then you'll be part of it, and you'll be part of it. You'll get information from it. So the goals are to support physiology educators, encourage them to explore evidence-based teaching, empower them to become leaders in physiology education research, and to set up collaborations in education and research. So in conclusion, evidence shows that student-centered learning engages students and helps the students learn. Activities can easily be adapted to virtual formats using Zoom and breakout rooms and having people do assignments offline and then bringing it in and turning it into the learning management system. Teaching innovations and educational research are publishable scholarship in many ways. So this is really exciting. The American Physiological Society and its new strategic plan is launching something called the Center for Physiology Education, which I think will be launched next summer. But all of the things that it's been doing in education will now be pulled together, and there'll be more programs and more webinars for physiology educators through this program. It's one of the highest priorities for the American Physiological Society. Some of the things will be free, but some of them you will actually need to be a member of the APS to participate in. So if you have any questions and you would like, or you'd like to get some of those case studies from me, you can actually email me at barb.goodman@usd.edu. Does anybody have any questions?
Dr. Barbara, I'm Dr. Suganti. I'm one of the chairpersons for this session. It was a very, very wonderful and very enlightening session, ma'am. And first of all, I wish to thank the organizers for giving me an opportunity to chair Dr. Barbara's session. And it was very, very informative. And ma'am, we really thank you for sharing all techniques you have been using, or interactive techniques for teaching the undergraduate students. And we are very much in need of that. That knowledge is needed here, because now we are entering into competency-based education, where we have to make the students learn by themselves. That is self-directed learning and all small group teachings where students have to interact. So your knowledge has helped us, I think, most of us very much, and very, very thankful for your presentation, ma'am. And that I have a question, that virtual rat, it was very interesting, ma'am. What is can you please give a few words about that?
Sure. Yeah, it's actually a setup where, at least I think it's in the endocrine one, that he has male and female rats, and the male rats are have been castrated. So, or half of them have. So they have intact male rats and castrated male rats. And then they actually look at, give examples of measuring hormones in those animals and seeing what the cause of the problem might be.
Okay.
So it's really kind of fun to do. I actually just copy the pages with the rat pictures on them, and it has the data that they're collecting, the various drops of the hormones and the measurements of the hormones. And then they use that to try to figure out what the unknown hormone is that they're looking at. So it's kind of interesting.
Okay, ma'am. Thank you, ma'am. We have one question session, one question from a participant, Dr.
Okay.
Bhavana. She has asked that they've been using this problem-based and team-based learning, but we have 150 students, ma'am. So how to go about such sessions for a large class like 150?
Well, I used to, when I first started doing Think Pair Shares, I actually had a class of about 150 biology students.
Okay.
And on the very first day of class, when they showed up, I actually had them write down a question they had about physiology and sign the names of the 3 or 4 people that were in that group, because I had them just group around in the classroom. And generally when students sit in a classroom, they sit in the same place.
Okay.
And so from then on, when I asked an open-ended question to the class, I would actually pull a card with those names on it of the people that sat together on that first day of class. And after they had a chance to think and pair, I would call on them to share.
Okay.
And, you know, they were scared to death because in their biology classes, they'd never had to talk in a 150 person class. But I actually asked them to call. I would call them and I'd say, you know, well, what did your team say? And then if somebody said, well, I don't want to answer that, or they weren't even there that day, I would call a different card until I got somebody who was going to answer the questions. So you can do it in a large class. You just have to, it takes time, and you wouldn't want to do more than, generally what they say is if you're going to do something interactive, it's about once every 20 minutes in the time that you're giving a lecture instead of more than that. So you wouldn't want to do more than 2 or 3 in an hour lecture.
Okay, ma'am. Actually, our lecture session is for 1 hour, but 40-45 minutes, not more than that, we teach them. And in between bringing this interactive is a lot of planning is needed, ma'am. That's what, lot of planning. That's what is very much needed for the teachers.
Yes.
Thank you. Thank you so much, ma'am. Thank you so much, ma'am. Pravati, ma'am, you have any questions for ma'am?
I'd like to ask Dr. Varvara, the various methods that you described that you are using for teaching endocrinology, from students' point of view, which method they prefer most?
Oh, I think they like the cases. Yeah, no, they definitely are case-based people.
Case-based learning, yeah.
Yes.
and have you done any evaluation of which one is best if we think of outcome from outcome point of view, that is
assessment. I would love to know. Yeah, with these occupational therapy students, I don't actually see them again after their first year, and they do have to take a certification exam. And I've basically heard through the grapevine from the faculty in their department, I'm not in their department, that they're doing well on their certification exams. But only once in the 5 or 6 years that I've been teaching this course have I had a student come back to me and say something about something she learned in the class. She said she was out in the clinics and they were doing a pulmonary function test, and she was thrilled that she actually could explain it to the person who was there watching that didn't know how to do it, because we had done them in class. And so I wish I could actually do that. You did mention my paper on the medical biology major, which is an undergraduate major for pre-professional students. We are in the process of evaluating the data as to what happens to those students now that they've graduated. Are they going to medical school or dental school or veterinary school or PhD programs? And we've got that data, and we're in the process of writing the paper. So we hope to have something from the undergrads, but I don't have anything that I can say from the occupational therapy students.
Nice. So my last question will be, you are able to accommodate all these methods within the designated teaching hours, what you have got?
Well, my class is actually 6 hours a week.
Okay.
So, or 3 hours a week. So for the occupational therapy students, it's a 60 contact hour class for 4 blocks. So 15 contact hours for each system, but we meet for 3-hour sessions.
So, I mean, it is not an like the usual classroom teaching. So, I mean, most of this is given as home task. They prepare it, and then whatever is the contact hour, you can evaluate and
Yeah.
clarify their
So
doubt.
in my 3-hour block, sometimes I give an hour lecture or review lecture on the material. And then for about an hour, they do something like measure pulmonary function testing. And then I give them time to actually go and do the case studies with their team.
So
So
the distinguished feature what you told, I found compared to Indian students and your students, they don't have to come to class for attendance. So I think
It's only the occupational therapy students that come to class because they have to.
I think
Not
that
the
makes
undergrad.
that makes the difference, that they are free to self-learn and go through all these processes and explore the subject themselves.
Well, you just have to give them assignments that in breakout rooms, they have to do something and come back and turn in something.
Yes. Thank you for this interesting session.
thank you
Sure.
very much, ma'am, for this interesting talk and very, very informative and very crisply and very neatly given. And very, very thank you. Thank you to you, ma'am. Thank you.
Sure. Thank you.
Yes. Yes.
Hi,
ma'am.
Dr. Barbara. Dr. Lakshmi here.
Yes. Hi.
How
And-
are you
and
doing,
where's-
ma'am?
Where's my friend Om?
Probably she's attending. Yeah. She's in the
She knows me.
yeah, she's in the attendance group. Yeah, she's
Yeah.
in the attendance group, and definitely she's watching you. Yeah, she's in the attendance group, ma'am.
Good.
Yeah.
Did you have a question?
No, ma'am, I'm very thankful to you for having accepted this invitation, and that too when your family everywhere, like in US, you are celebrating this Thanksgiving. Friends
Right.
and family are visiting, but still you were kind
Actually-
enough to accept our invitation.
Right. No, it's just my husband and me, the dog and the cat. My family lives in California. So we're gonna visit them over Christmas. So
Okay. Thank you so much, ma'am. I'm really glad that you shared so many resources for the educators. Like it is really going to help us.
yeah, that'll
Like
be great.
it is really going to transform the way we are teaching presently. Definitely, we are going to look through all those resources, and we'll be really benefited by that.
Good, good. Yeah.
Yeah.
And join Peacock because we'd love to keep you in our group.
Yeah, ma'am. Sure. Thank you. Thank you,
Sure.
ma'am. Bye.
Bye.
Thank you, ma'am.
Thank you so much, ma'am. Still, we are also in India. We are trying to practice our student-centered learning, and all our permutation and combinations are there in still in pipeline, and we are ready to receive our outcomes. Really, we are thankful on behalf of our organizing team. We'd like to thank our speaker and chairpersons virtually.
Thank you.
We'd like to thank our speaker, Dr. Barbara Goodman, with the memento and a certificate.
Oh, the memento is gorgeous. Thank you. Yep, that'll be very nice. Thank you very much.
And we'd like to thank our chairperson, Dr. Pravati Pal. Thank you so much, ma'am. And we'd like to give our token of thanks and appreciation to our next chairperson, Dr. Suganti. Thank you,
Thank
ma'am.
you. Thank you.
Now I would like to hand over the mic to the next session on ethical consideration of COVID-19 related to clinical research. Over to you, ma'am. Thank you.
Thank you. Thank you, one and all. Thank you.
Thank you, Dr. Pravati. Thank you, Dr. Suganti.
Thank you, ma'am.
Thank you.
Thank you. Thank you.
Thank you very much.
Thank you, sir. The next two scientific talks are from biomedical research, and they will be chaired by Dr. Ayadurai. On behalf of the organizing committee of BMSECon 2021, I welcome Dr. Ayadurai, and it gives me immense pleasure to introduce our chairperson.
Yeah, I think I'm audible to all, am I right?
Yes, sir.
Okay.
Mr. Niraikulam Ayadurai is a principal scientist, Biotechnology Division, Central Leather Research Institute, Adyar, Chennai. He did his PhD in biotechnology from Pondicherry Central University and postdoctoral research in the Division of Biomolecular Engineering, Busan National University, South Korea. He was Assistant Professor, Department of Biochemistry, King Saud University, Saudi Arabia, and School of Biotechnology, Engnam University, South Korea. He is currently leading a multi-crore project on biofabrication of leather funded by CSIR and developing blood-resistant bone graft binder for in vivo bone regeneration through engineered cement proteins funded by ICMR. He is involved in building a microbial taxonomic research unit in CSIR Chennai, supported by the Ministry of Environment and Forest. He has carried out several protein engineering works supported by national and international funding agencies. And he is the recipient of Young Scientist Award, Uppsala University Award, Sweden, among many others. He has 3 patents to his credit. He has more than 50 impactful publications in highly reputed journals. Sir, you are an inspiration to the budding researchers. So the first talk is on scientific writing, peer review, and research integrity by Dr. Vaidyanathan Selvaraju, visiting scientist, Department of Nutrition, Dietetics, and Hospital Management, Auburn University, USA. I request our chairperson, Dr. Ayadurai, to take over this session. Thank you, sir.
Thank you, Sandeep, and good morning to all. Vaiti, I don't know whether it is good morning or good night. So I'm really very happy to part of this wonderful seminar. And I'm so, I'm really pleased, to introduce Dr. Vaidyanathan. I know him from 2006 as a researcher, as a co-researcher, and I could see his journey. He traveled from Pondicherry to different institute to, create or learn a new kind of research. Vaiti has currently is a research scientist and in Urban University, and he's mainly focusing on molecular basis of disease like reproductive biology. I know him; he's very much interested on reproductive biology. When you as a person, if you talk to him, he will talk more about reproductive biology in any manner. So I know him very well. He's expert on that particular field. And he also completed his postdoctoral research from Connecticut Health Research Institute from USA. He having a lot of publications, and he is also be one of the topic editor in one of the MDBA journal, and also he act as a guest editor for obesity and inflammation. And he is a eminent scientist and scientific person in the particular reproductive biology. So I request Dr. Vaidyanathan to take over the chair, and I request you to present. And if any questions come from audience or fellow colleagues would like to discuss, then please join with us. Vaiti, please start your journey. Thank you.
Thank you, Dr. Ayadare. Thank you for the introduction. I hope I'm audible to everybody.
Yes, sir.
Yes, thank you. And the topic is going to be the scientific writing, peer review, and research integrity. I know for the budding researchers, the first two part may be like interesting, and but I want our even the all the faculties and scientists, they should know the research integrity so that they can manage their students and their results, what they brings, all those things, so that the quality scientific writing can be done in the future also. Yeah, you could see the screen.
Yes, sir. We can see, sir.
Yes, thank you. Yeah, the scientific writing, like it is the communication between you want to communicate your results and your findings to other scientists. That's the way of writing. So in the scientific writing, there are different types are available. Writing the original article, like your own findings, if you're doing, and with the appropriate method, and you're communicating with the other scientists, that is the original article. And the other one is a review article in the field. If you are an expert and you are making an either literature review, like collecting other published articles information and making a concise review article, if someone read your review article, they can understand, and it is going to help them to give more information. If not, you can do a systematic review. So this is analyzing a number of articles and then bringing to a review format. That is known as the systematic review. And another form of scientific writing is book chapter or books you can write. In the book chapter, like it's under the theme, you are going to write the book chapter and then letter to the editor. It is going to be the communication between the scientist and the audience. Audience is going to be another researcher who is interested in that area. And then the theoretical article, some articles are contributed to theoretical foundation, like writing for the foundation kind of thing. So those are all comes under the theoretical articles. And book review, if someone published some interesting topic book, so you can review that book, and it is going to give information to the other readers, whether they can buy the book or they can read the book. For making your scientific writing, you need to have a comprehensive literature search and literature review you should have. Even this we are going to do before starting our research. You are going to do the literature search, and then you are going to fix your hypothesis. For that, the useful websites you can do, like search engines, you can use it, PubMed, Scopus, Web of Science, and then other like Google Scholar or other search engines are available. But most of the informations are available in your PubMed, Scopus, and Web of Science. So they give a research article. Mostly acceptable research article can be seen in these 3 websites. And if you do the thorough review, your article is going to be a good one. And the structure, when you make your article, there is a format for your article while writing. So the title of the article you have to make, title should be attractive mostly. Either it can be like declarative title or sometimes descriptive title. Sometimes it summarizes the results, like what results you got. Based on that, you can summarize the results in the title itself. Sometimes some short titles will be there. Those are all eye-catching titles. So if something like you can make a eye-catching title for your review articles. That kind of title you have to choose first, so it attracts the audience into your article to read. And next one is the authors. So who are all going to be the author and who are going to be the corresponding author? When you make your authors, try to make like who contributed. Based on that, you make your authors list. In the research integrity part, I will discuss about these things more, about the authorship. And then next one is the abstract. So usually the abstract is just a preview of your article. When you want to read the article, most of the people try to read the abstract. If abstracts looks good, then they go to the article to read. And sometimes some people will have only access to the abstract. So from the abstract, they'll get the knowledge of that paper. So the abstract should be a concise one, and it allows the readers to quick scan the article. And then it should be less technical, like don't use much scientific words like what you're doing in the paper. And it should be one paragraph. It should not contain any references on it. And also abstract should be in 150 to 300 words. So sometimes the abstracts are either structured or the paragraph abstract. Structured abstracts are nothing but you write a background, methods, your results, and discussion in the abstract itself. And writing the introduction part of your article. So it is going to give you a summary of your background information about the current topic, and your hypothesis is going to be discussed, and what is the research gap. The research gap, that is the main thing. If this part, your hypothesis and research gap, is not written well, your article is not going to be sell anymore. So that part you have to write very well. And the introduction, usually you can write it in the tense wise, like present tense you can use to write the introductions. And also sometimes you can use present perfect tense with passive voice when you are referring with previous articles. And writing the methodology, materials and methods, this part is very important. If someone want to reproduce your results, or they want to follow the technique what you used, so this part is very important. Here you have to give maximum information. So the experimental protocol needs clearly written, and other scientists need to repeat. This one means they have to repeat. So for that, the information needs to be given properly. And you can give in a diagrammatic format also. Sometime if you are using some antibodies or some other things, some chemicals, you want to give it as a table or flow chart, that is also fine. And when you write the like ethical consideration, what kind like animal ethics, or if it is human subjects are involved, then those ethical consideration need to be given properly. And statistical method, especially the statistical methods, what kind of statistics used in your study, all those need to be clearly given in the methodology section. And this section you can write it in the simple past tense, because you are going to write your completed work. So you can write it in the simple past tense, all the methodology part. And if you are writing the diagram or table, those things you can write with the present tense. And when you write the results part, results should contain always your figures, like the obtained results will be in the figure format, either with in the collage form, or you'll have individual figures. And then you can give it as a table format also. If you have a statistical results, you can give it in the table format. And then use appropriate graphs and tables, and the statistical values, what way it is mentioned, whether it is what kind of statistics you are representing there, give as a footnote for those things. And then you have to give any other significance is there, those significant values you can give in the parenthesis. and use for writing the results. This is also you obtained your results, so you are done with your work. You can use past tense to write the results. So that is very important here when you write the results. And then if you're again like methodology, if you're explaining your figures and tables or graphs, you can write with present tense. So this part is going to be helpful for the graduate students or who is doing masters. If they are writing any article, this part is going to help with them. And then discussion part, when you are going to discuss, highlight most of your results significance, how significant results you got, write those things, the significant of the results, not the results as such as a repetitive one. And then do the data reported to the results supports your hypothesis, that you clearly mention your discussion part, and you summarize the other people's research work, whether it is supporting or opposing your work. Even it is you may get some opposite result to them, you can report and you can defend whatever supporting data you have, and using that you can summarize your results, discussion part. And in the discussion you can use past tense to summarize the findings, and then present tense when you interpret your results part. Next one is in the research article, next to the abstract, conclusion is important. If someone read the conclusion, that is your take home message. So from that they will understand your whole research papers idea. So see whether the summarize you are summarizing it properly, and the major implication of the studies are involved in that conclusion part. And then any limitations are there, especially when you do with some human studies, any limitations are there, or even in animal studies you have a number of animal limitations are there. So you can mention those limitations in the conclusion. And then if you're having a future research idea, you can give a hint in this place, like your future research idea you can give. And you can use either combination of the tense to write your conclusion, because you're going to tell about future research and you're going to tell about your conclusion, your results conclusion. So you can use a like combination of tense in this to write your article. Coming to the acknowledgement part, usually you have to acknowledge your funding agency, and then the faculties and our fellows involved with helping either statistical aspect or some of the technical aspect who helped, or sometimes you have taken help from the core facility. So all those things you can mention in the acknowledgement part. Give right acknowledgement for right people. And then if you have done any English editing with anybody, you can mention here. And so this is very important, because sometimes the article goes to most of the time you'll have a comment saying that English need to be rectified. So this kind of comments you'll get. So better if you do the English editing, mention the English editing part in your acknowledgement. So that gives an idea for them or for the reviewers. And references part, so insert appropriate references in exact that text what you are mentioning. Don't in different context, don't insert the other references. Nowadays there are a lot of softwares are available to do this one. I'm going to discuss about those things in the forthcoming slides. And the softwares generally used in the manuscript preparation, either we do in the Word file typing our articles. If not, nowadays LaTeX are available. So the LaTeX you can use, you can type there. So it gives like a PDF format, like publishable article. So that way you can use LaTeX. And then before the paper goes out of your hand, do a plagiarism check, so that you will not have any other issues. For plagiarism check, usually Authenticate is the very good one. They have more number of repository with them. So they will find out, even the scanned article can be find out through the Authenticate. The another version of Authenticate for the journals is the Crossref. So most of the journals, they use Crossref to scrutinize the article. Some journals, they have a window. Yeah, when you submit your article, it is going to go through the Crossref, and if you have more plagiarism, they will reject your article in that place itself. So plagiarism check is very important. And I know the Turnitin and Urkund, these are all the softwares like UGC, they used this one. And these kind of softwares you can use. And if you have two text, you want to see the similarity, you can use the similarity texture, that's freely available. While writing itself, you can find out whether you have any similarity. And writing your article, you need the statistical analysis part. For that, there are a number of softwares are used for statistical analysis. So the major one is SPSS, and mostly in biological science or in medical field, they use GraphPad Prism. But if you are doing any huge data analysis part, either SPSS or SAS, these are all the two programs. So these two programs are licensed versions. But our program is equivalent to SAS, but it is a free version. And I know the Origin is the one of the oldest one. So they also give good statistical data analysis part. Any of these packages can be used for representing your results in a statistical manner. And for doing your references, either EndNote or Reference Manager or Mendeley, like EndNote and Reference Manager, those are all paid ones, licensed versions. But EndNote is the best one for doing the references. You will not do any mistakes in the reference part. And Mendeley is a freely available version that is from the Elsewhere group. And RefWorks, another version is there, another different company one is there. And Zotero is a free reference software. You can use online this one. So these are all the softwares you can use when you prepare your manuscript. So and next step, we'll see about the peer review. So the peer review is another part of this scientific article. So once the scientific article is submitted to the journal, the peer review system is used to assess the quality of your manuscript. And then the independent researchers who work in the same field or who is expert in the field, they are the one going to see your articles. They are going to assess your articles for its originality, validity, and its significance. So the peer review process is explained in the diagram. So the authors can submit the article to the journal, appropriate journal. And once the article is submitted, the journals or editors will check the article whether it suits their aim of the or scope of the journal. Once it fits with the scope of the journal, they will check for plagiarism check and quality check. The quality check undergoes for your figure verifications and other kind of verification they will do. In the plagiarism check, some journals they reject if you have more than 20 or 25% of plagiarism. And in this stage itself, most of the editors, if the article quality not fits their journal, they will reject that article. And then if the article is okay, passed this plagiarism check and quality check, they send it to the 2 to 5 reviewers, and they give a time point to review. Once the review process is done, they send it back to the editors, and editors will see the comments. Based on the comments, either they reject or they give the revision to the authors, either major or minor, what kind of revision they will give. If this revision is minor revision, then immediately editor, after you resubmit, it will go for publisher for publishing purpose. If it is a major revision, again editor will send it to the reviewers for second revision, and then it goes for the publication. and who are all reviews this article? Who can be the reviewer to the articles? So who works in the area, same area, they can review the article, and they have to be expert in that field. And it's a prestigious one if they are doing, and they should familiar with the methods. So even I'm working in diabetes field, if I don't know some hospitality, like some of the human studies, then I should not take that article for reviewing. So that is very important. You have to familiar with the methods, not with the topics, because they give the abstract for your review. So by reading the abstract, you will get an idea whether you can review this article. And then make sure you have any conflict of interest, like they may be your collaborator or your previous mentors, students, or your friends, or those kind of conflict of interest is there. Don't choose those articles. And even if you have conflict of interest with the same field, some of the other competitor, don't choose those articles to review, and don't kill those papers sometime. And before accepting the article, think whether you have time and you have knowledge to review that one, because it's others' life also. Their article is going to wait with you for like 15 to 20 days. It is very important. If you don't have time, don't agree and don't hold the paper. So if you agree, you review and then give the comments. If not, decline and suggest who is expert if you know. And there are different types of peer reviews are there. Depends upon the timing. I think the peer reviews, single blinded is there, double blinded, and then open review is there. So single blind, like this is the one most of the journals follows. The author's names the reviewer can know, but the reviewer's name authors cannot know. So that is the format of single blind. So the authors, the reviewers has advantage here. They can read the author's previous manuscripts while reviewing this article. But sometime this single blind article gives the discrimination of gender and nationality. This is the place I was talking about, English language. So they bring the English language when it comes with the nationality. This is the cons of this single blind review process. And double blind review process, the reviewers don't know the authors, vice versa. It is happening mostly in the social science and medicine journals, and some of the elsewhere journals, they have this kind of double blinded review process. So authors also will be protected, and the reviewers also will be protected from the criticism. If the article is good, the reviewer is going to be giving the good comments, and also if the article need to be improved, the reviewer will give constructive comments to improve your article. And then open review, most of these future medicine, those kind of journals, they use this open review. So the reviewer name also will be available, the author names will be available while doing the review, and after publishing also. Sometime they do the comments also published online, so the reviewers comments can be viewed by readers, that is other scientists. Another one is transferable review. So this when you submit the article to the journal, if they have a group of journal like Elsewhere, Springer, those kind of publishers, if article is rejected in one journal, they will transfer with the editor's comments to the next journal with your permission. So this is another form of review. So sometimes this one is not accepted with all the editors. Some editors may feel the rejected article is coming to us, but depends upon the editors, it may go through also. And then collaborative review, this one is used to improve your article before publication. Like there is a team of researchers will be there. They send each other article to others, and they will review 5 to 10 people will review the article, and they give their comment based on the comments. They improve the article, then go for the publication. So that time from the external reviews, you will get very few comments. So that kind of constructive things you can do with collaborative review. And post publication review, some journals, they are doing this post publication reviews. So after the paper published, you can comment on that paper. That is the another format of commentary. Like you can write online about your comments. So the peer review process, how it happens, and it is that we can see means once the reviewer gets the invitation, he can accept by reading the abstract, and then he has the chance to read the full manuscript. And sometime after the abstract is little different, you cannot understand the article. After opening the article, you can see it may be like one of the, if it is double blind at some time, one of your known people or a collaborator, any conflict is there, you can communicate with the editor and return the article. And these documents are confidential. Of course, now the journals are giving one more opportunity for the research scholars. Like if you review your mentor's article for experience, your mentor can mention in the review process, there is a column, if anyone helped to review this article, your mentor can mention your name there. So it is a credential for you. And you are learning also from your mentor how to do the review during your PhD itself. So when you have a thought of those kind of review, your article you'll try to improve. You will stand in opposite position and you will view your article, how to fix some of the flaws in your article. So that helps the students very well. And doing the peer review process, while doing the review, the reviewers can split them into either gives the comment based on the subheadings like abstract, introduction, methods, whatever comments they want to give for each section they can give, or all together they can give. In this place only you will get more constructive comments. Some of the reviewers really I got like very good constructive comments, and I could improve the article and get it published because some of the reviewers gave very good comments for some articles. So that is very important here. And in the abstract, like read the abstract as a reviewer, whether it is standalone and you can understand without any other supportive material your abstracts. So that helps. Then you can review accordingly. And then write the rationale of the study and explain your goals, whether it is explained properly in the introduction. And mainly the methodology sections, as a reviewer, I will see the methodology section mainly, and whether they have used appropriate statistical method in that, because the data may be like test for normal, they may not be normality wise good data, but they might have done different statistical analysis for that. So that aspect you can review the data here and the methodology itself, what kind of data they have. And then in the results part, review their article, previous article, and then see any redundancy is there, and then see the integrity of the data. And that is also an important part of reviewer. So if you miss, it is going to go to most of the audience, like other scientists, they are going to cite the article. And if this article has data with flaws, then it is going to affect whoever is going to cite. So better if as a reviewer, if you block, if the data is not research integrity wise, it is not good, then you can block the article, stop the article there itself by giving constructive comments to the editors. And see the discussion part, whether the authors have not repeated the results again and again, and see whether they have compared their results with previously published reports. And while reading as a reviewer, if you see this kind of article already published, or it is published in some other population, look into that, whether they have cited that article or they have mentioned the opposite results, whatever other people are getting. Those kind of discussion, healthy discussion is done in the article that we can check as a reviewer. And then look at the conclusion part, whether it conveys author's hypothesis, exactly what results they got. And cross-check few of the references at least, so that the text is appropriately written, and look for ethical approval. Mostly ethical approval will be there, but make sure it is there. And while writing the comments also, write comments to the authors and editors. It should not vary heaven and hell difference between authors comments as well as the editors comments. If that much of difference is there, you will have conflict, like the editor will have hard time, because the authors will come with rebuttal. That is going to give trouble to the editor. And as a point of like you are an author, think that way, and then do the review, and then advocate in the position of author, editor, and readers, so that you can do a good review. Research integrity. This part I would like most of the PIs, like the faculty members, need to know this one, and they have to train their students very well in this part. Even in November 22nd, I think in India it is published. There is an article in a paper published. There are 80 research articles are having figure manipulation or misconduct from DRDO institutes. So totally from the DRDO institute, 80 articles are having figure manipulation. Of course, I know it is not with the faculty members or with the students. It is the lack of knowledge which gives these kind of issues. That's why UGC brought in 2019 itself a paper. The students, the research scholars, as well as the faculty members who is having a research scholar, they should have this research and publication ethics, a 2-credit course. That's what UGC recommended. And this is the curriculum for that paper. And what is responsible to conduct the conduct of this research and misconduct, how we can find out. The misconduct is 3 words like FFP, either falsification, fabrication, plagiarism. So in these 3 only you can mainly find out the misconduct of any articles. And either it may be like error like if you did mistakenly like some error, or misconduct or fraud. That 3 different things are there. We have to know the difference between these 3, and either intentional or non-intentional. So that we have to know. And then whether these kind of mistakes can be identifiable, like even by normal eyes we cannot identify. So that is very important. Whether it is detectable or non-detectable level problems are there. So those things need to be done. And this comes with the planning of research. In the planning of research, if you are involved with the human subjects, protect them and get the proper IRB approvals. And if you are using animal, then you should have the animal ethics committee approvals. And if you have a conflict of interest with any funding or any other company funding source, then make sure those are all mentioned in your article. And for data management, you have to maintain your data and report the paper in right way, and then proceed with. So this happens sometime like multiple submission of the research article. So don't do any research article multiple journal, like do it to one journal, submit to one journal. If they reject, then go to the next journal. That is very important. It happens sometime with some early career people, like they don't know, they sometimes send it to 2 journals, or sometimes the mentor gives to the students permission to submit the article. Sometimes they submit to 2 journals. So those kind of issues need to be avoided, and that should be taught to the students also. And plagiarism is the major part, like in number of countries, the articles are retracted due to plagiarism. So even if you do your own article, part of it, you cite it properly and then make it, whether it is self-plagiarism or without self-plagiarism, mention it clearly there. And the next to the plagiarism, thinking the plagiarism, lot of people started finding synonyms for each word. There are some softwares are available online. People started using that one, and that gives very awkward words for each disease or any other terms, scientific terms. So these kind of things are known as tortured phrases. So those kind of phrases, like even cancer can be written in different term to avoid plagiarism. Those scientific terms or scientific chemical names or other things, no need to change synonyms. Like write it in your own words. You don't need to worry about the plagiarism part at all. And in the research misconduct, like one of the number of cases are there. Just one case I want to show here. So this case is from US, and it is this case is published in Nature. This is the research misconduct where the researcher did sabotage. Like one person was doing the research. Her results were not consistent. They had a problem. Finally, they kept a camera, found who did this one, what he did, and that message is published as a paper in Nature in 2010. So even 2010 here, they made the education this way. And some of the reviewed article, like I could, when I review some articles, I could see these kind of misconducts. One article when I was reviewing also, I could see that the submitted manuscript, they have a protein Y. I mentioned protein Y, not to mention exactly the name. So some protein they have mentioned and they submitted this figure. When I read their article and go for the review, while reviewing, I could find this is another article, and they have part of another article's figure is here with a different protein staining name. Like if it is a protein GAPDH, here they are talking about protein AKT. So two different kind of protein with the same cells, it is not at all possible. This is really a data manipulation, and sometimes unintentional is there. Unintentional is if you replace the whole image, that is also like unintentional, you can say and you can prove it. But someone who does these kind of cropping or making it a different one, so those kind of things are not acceptable in the research. Those kind of research misconduct is the one, as I told before starting this topic, like 80 articles found from the DRDO group. And another article, when I was reviewing, I could see the authors submitted these figures as the figure group 1, group 2, different groups. But when I was reviewing their own article, I could find this figure published in different paper of their paper, and they have taken part of it and said this is group 1, this part is group 2. So these kind of figure manipulations are not acceptable, because it is going to go pass on to the next people. And it may be like if a proper knowledge is not given also happens, or deliberately some people will do this one to complete their course, or deliberately some people will do to get more credential in their life. So that is not acceptable. And sometime it happens in a lab with only one researcher. So if he goes away, this kind of misconduct won't happen. But there are some people, like either it is continuing in the same lab, and you have to think about it, who is doing that one. So when I was reviewing another article, I could see that one manuscript, published manuscript like this, and the reviewed manuscript also, they have the research misconduct. The same figure they used in different group names. And Next one is publishing with predatory journals. So never publish any article for sake of promotion or something. Do it in right way and don't go with predatory journals. They will say it is very fast acceptance within 24 hours, 48 hours, but they are not going to be reviewed at all. There is no peer review, and they will have the article processing charge, as well as they will have the editorial deceptions, like especially this is main thing. You may not know aware, some of the faculty members not aware, their names may be used in some journals as editorial board members or editors. And those kind of fake editorials are created by the predatory journal people, and they are using, and they mention in the website it is accessed with PubMed or Scopus with impact factors, all these things. So go to the right indexed journals and then choose that journal for your publications. I'm not talking like this one I brought here from the JVC because all the paid journals, like if you are paying money or open access journals, are not predatory journals. That's why I brought these two things. Even JVC in 2000, they since based on the act, the country's act, if you pay something for it, and it is known as advertisement. So JVC, it's a 125 years old journal. You can see they mentioned the article as advertisement, but in future the law changed. So here also they changed. Nowadays they are not giving that one in their list. So how you can avoid this misconduct? Try to, all the researchers try to maintain the notebooks, what research you are doing, and then there are number of online tools are available to maintain your database. Drives are available, you can maintain that. Maintain the your results in soft copy as well as the hard copy. This is very important because we cannot rely 100% on soft copy, 100% on hard copy also. And then for preparing your manuscript or anything, or to know some of the figure manipulation, to stop that one, you can read the instruction to authors of some standard journals. They have very good instruction to authors how to prepare the figures and what is manipulation, what is not manipulation. They have mentioned in that. And when you're collaborating with other lab or other group, so verify that data. Your name is there means verify that data, and then what is your role in that article, accept it. I could see nowadays there is a trend publishing 200 article, 300 article in a year. Humanly it is not possible. It is because of like known people giving authorship to others. That's what the problem comes here. And then as a mentor, update yourself, and then update your fellows with current techniques, and then good lab practice things. So that helps to avoid these kind of misconduct and bringing good publications. That's all about the presentation today. And anybody has any question?
Thank you very much, sir. Over to the chairperson.
Thank you, Vaiti, for
Yes.
your elaborative discussion on scientific writing, which is very important at the moment, because a lot of researcher knowingly or unknowingly they are doing it. Some of the mistakes that reflect a huge amount of impact on their research. Sometimes, most of the time, the PA is one of the major person going to affect by this kind of activity. So student has to be very careful, because most of the time the PAs are highly dependent on the students who is working in the laboratory. It's very difficult to monitor them, and those people will be strongly believe them. But as he also mentioned that if the things are going to be intentional, then it will not be appreciated. That has to be taken and validated. Dr. Vaiti, one question from Dr. Sinde. He mentioned that very good and informative talk. He has asked one question: will it be ethical to review articles from your own institution, even if the author don't know that you are the reviewing the article?
If you don't, there is like a small conflict is there in that, because you will be favoring to your institute sometime. So that kind of time, you cannot review those articles, even it is from your own institution. Like you are working in biotechnology department, if I'm working in biochemistry, I cannot review your article, because somehow it is going to be, I'm going to favor to my university. That's not acceptable sometimes.
Okay. So another question, Dr. Pallavi asked that what is the criteria for sample size? What is the criteria for the sample size?
Yeah, I have mentioned in the comment itself. It is like sample size. You can do power analysis prior starting your experiment hypothesis, setting your hypothesis. So the power analysis will give you, based on your significant criteria, how much significant you are setting up. Based on that, how many samples you required for animal studies or human studies or even cell culture, whatever you are going to do.
Okay, one more question from Hariharan. Is there
Yes.
any website showing the list of journal with index?
Yes. Only website which gives the indexed journals list, everything is Web of Science. They have the journal citation report. So that gives all over world what are all the journals are available, whether they are indexed, whether they are having impact factor. All those details are available in Web of Science. And every year, July, they release the new impact factors.
On behalf of others, I have one more questions. Like
Yes.
you have mentioned during our presentation, English writing. I mean that writing in English. I mean submitting a paper. Especially most of the journals are hosted by foreign countries. I think India, we have a couple of journals, but still people are when we are looking for high impact journal from foreign country, especially from English speaking country. Whenever we submit a paper, although it's novel, the usual question we usually get is English writing. But you also know that when we are certifying, or when those people asked, go for English writing or English, native speaker correction, it involves huge amount of money.
Yes.
Yeah. So how a country like India can overcome that one? Because it became one of the very big noise these days. Although the data is good, and even we write it much better way, they are coming with this kind of comments. And when we really want to give the certificate, it is like a huge amount of money. We can go with open access.
Yeah, that is the business.
So how do you feel that one? How we could manage that kind of things?
Yeah, that one always we have here a system like that's what I said, collaborative reviewing. So we send it to some of our collaborative reviewers. We will not expect any authorship. So what we will do, we will send our article to them to review and to do English editing or anything required, and we give them acknowledgement in our papers. And this our institutes in India, they have to recruit a few people from English, and they have to run a department English editing for each university or institute. Here in abroad, like in US, we have English writing center. Even though here everybody doing mother tongue English, but we have an English editing system in our library. So we send it to them. There they do the editing part and give a certification also in our university itself. So these kind of arrangements, if our country like in India, if they are doing, that will be more helpful for the students.
Okay. Thank you, Vaiti. Although you are abroad for a very long time, still
Yes.
happy to see that you are very still updated with all the UGC rules and everything you are finding out right away to the students. That's very important because
Because
when-
as a member, I am also facing, like, I want our students should come abroad with full knowledge.
Okay.
Yeah.
Okay, thank you.
Yeah, thank you. Thank you. Dr.
So if anything, any more questions or anything? Oh. Chairperson, co-chairperson, shall we close the session and we can go for the next speaker?
Yes, sir. Thank you, sir. We would like to honor Dr. Vaidyanathan Selvaraju. A good research backed by good scientific writing and peer review can take the quality of a paper several notches up. Thank you, sir, for an extremely useful session. Now we will move on to our next talk, amplification-free SARS-CoV-2 detection using bio-nanoparticle and ultra-sensitive nanoprobe by Dr. Selvakumar Edward Raja, Senior Research Officer, Australian Institute for Bioengineering and Nanotechnology, University of Queensland, Brisbane, Australia. I request the chairperson to introduce the speaker. Thank you, sir.
Okay, I think we little bit revamp by Dr. Vaiti, like what is the ethical issue you are supposed to follow for your writing paper. Now we are shifting a little bit in depth to the research. I'm very happy to introduce Dr. Selvakumar. He is currently working as a senior research officer in Australian Institute of Bioengineering and Nanotechnology in Queensland University, Australia. Before he started his journey as a senior research officer, he worked as a postdoctoral fellow in University of Buffalo and Arizona State University. He also completed his PhD from Pusan National University from Professor Santuli Lab. He completed his master degree from Madurai Kamaraj University, and later he is also one of the recipient of one of the prestigious YEMBO long-term fellowship, where he want to now generate next generation antibody. Especially, he wants to introduce the unnatural amino acids to expand the genetic code of antibody to create new therapeutic approaches. So later, now he mainly focused on his research on point care diagnosis, or like he would like to use his expertise on synthetic biology and protein engineering to develop a novel protein-based biosensor for nanobiotechnology. I would request Dr. Selva to begin your discussion, and we are very happy to hear from you. Please kindly carry on.
Thank you, Dr. Ayadurai. Can you guys hear me? Is it audible?
Yeah, we are audible. Please go ahead.
Thank you so much for the nice introduction, Dr. Durai. You missed one thing, that you didn't mention that we worked together. Yeah.
Okay. Be pleased to say that I'm always proud that Silva, I had a great chance to work with him during my postdoc, or even we traveled together from Pondicherry University.
Pondicherry
He was completed
yeah.
bioinformatics center. He completed his certificate. He was a good bioinformatician. He is always inspired like us to do some kind of protein modeling. Now we are more and more working with the protein modeling others. So he is one of my inspiration always. There is nothing. I'm very always happy, proud to be a one of the co-colleague or friend to work with you. Please kindly carry on.
Thank you so much, Dr. Durai. I want to thank you. I mean, you are not just a senior. Like initially, when I joined my PhD, I was like, as you said, I was a bioinformatician. You guys helped me to move to the all wet lab things. So you guys taught me all the wet lab things, and now I am completely doing the wet lab things. Not anymore the bioinformatics thing. I'm using a little bit, but not intensively. So I have to thank you guys for that. Anyway, let's get into the topic. Audience are waiting. So I had to share my screen. Okay, is the screen visible?
Yes,
Can
sir.
someone confirm? Okay,
Yes,
yeah, thank you. So yeah, my talk will be a little bit, as Dr. Durai mentioned, my talk will be more research thing. I'm not going to talk what Dr. Vaidyanathan or other people spoke, not related to that. It's more of how we made an attempt to do some SARS-related work in our lab and what we learned from that and where we are now. Just wanted to give some glimpses to the world how each research is helping for stopping the COVID in the pandemic situation. So here today I would like to present a topic related to SARS, which is like amplification-free SARS-CoV-2 detection using bio-nanoparticle and ultra-sensitive nanopore system. So this is the platform is entirely developed in our lab, and we made an attempt to use it for SARS-CoV-2 detection in a different way, how rather than in a normal way, how people are doing, and rather than a conventional way, it's a little bit different one. So I would like to highlight how we did that during the pandemic time. So as you know, I mean, this is the first slide. Most of the COVID people present the statistics of COVID spread or death rate data. I'm not going to say any detail about this one, because almost everyone in the world got directly or indirectly affected with their family members or parents or by themselves. So every day it's the infection is increasing, and everywhere it's going like second round or third round. So we need a solution for this in a permanent way. So, and this COVID, at this situation, COVID disease forced the scientific community to rapidly develop different things, especially diagnostic research. So to try different diagnostic kits to develop finding the SARS-CoV-2 virus in a very reliable way, right? And also in a very rapid way to screen the whole population-based manner to stop the spread of infection. So what is unique about COVID-19 is, I mean, not unique, the problem is the clinical symptoms associated with this disease is not very unique. They are very common, say for example, and also it differs from person to person, especially, I mean, you can see cough, sore throat, this kind of symptoms appear even in normal fever. So we cannot, unless you do some molecular, the prescribed detection thing, you cannot confirm whether it's a COVID or a normal fever. So there is a need for having a specific diagnostic kit to be developed for COVID-19 detection. The other challenge with this COVID-19 is the symptoms appearance. So unlike other diseases, this disease, even before the clinical symptom appears on the patients, they get infected. They started transmitting this. They become infectious to other persons even before they become symptomatic. Especially some portion of the people, even they are asymptomatic individuals, where even after infection, or they never saw any symptomatic related to COVID infection, but they keep spreading the diseases to others. So this is another challenge, how to stop the viral transmission in an early detection, in an early stages. So as we all know, RT-qPCR is the WHO recommended and most gold standard recommended diagnostic way for molecular testing to decide whether this patient has to be quarantined or not. So this is a global issue. Who has to be quarantined? So as we know, most of these RT-PCR methods, they require viral RNA amplification. So, and the advantage of this method is they have the superior sensitivity which goes as low as 1 copies per microliter detection level. But at the same time, the limitations for this detection method is people have to process the patient sample to extract the RNAs from the sample. And also, while doing this, there is a potential possibility of bias in amplifying the target sequence. So this leads to a confusion of whether the patient is, especially in the early stage. In the later stage, the viral load are high, the results may be more consistent. But in the early stage, where people get the symptom appearing stage, when they go and test the sample, they always get a confused result. They may be positive, or sometimes the results are not clear. So this is the problem with the biased amplification of RNAs in the PCR-based system. So the other possible way of detecting SARS-CoV-2 is protein-based systems. So the well-known protein-based detection system is quantifying or detecting the antibodies raised against the target antigen, like SARS-CoV-2 virus. But the problem is here, the antibody appear only after 2 weeks or several weeks. So in the early stage, again, the problem is the protein-based system detection method is the serological based system is not applicable. So there is one more way people can try is directly detecting the proteins present in the viral, like spike proteins on the surface, or the nuclear protein which wraps in the RNA inside the virus. So these are the proteins that can be detected in the early stage. There are reports that nucleocapsid proteins are appearing even in the first day itself when person gets affected, especially if there is a report coming that a community got infected. If someone wants to screen that community alone, so you can directly go on, we can try this method, detecting the spike protein on the first day itself if the person is getting affected in a community transmission. So there it comes, the protein-based detection system is better. And but the problem is, so here the picture shows the general rapid antibody test kit generally people developed. So here, as you can see, mostly people use the full antibody against the spike protein or the nucleocapsid proteins, the target viral antigen. All these methods, most of these methods, they relies on the use of monoclonal antibodies, and they are relatively expensive, and producing them is very time consuming. And the other problem is there are batch to batch variabilities there. Apart from this, the key issue behind this monoclonal antibody production, the based detection system is they are very less sensitive than PCR test. Remember, as I said before, the PCR test can go like 1 copy of virus detection in 1 microliter, whereas the protein-based systems require a lot of viral loads to detect them. So we decided to set up our own in-house developed technologies to have an ideal platform for accurate detection using protein-based diagnostic system. So we defined some of the criteria to have an ideal platform for accurate detection. The first one is the system should be a cost-effective and stable probe, and it should be suitable for mass production for the pandemic, like community detection in different places all over the world. We need to be able to produce mass amount in a quicker way, and it should be cheap. And the second criteria is the molecular probe should be sensitive enough to allow an early response. So the sensitivity should go comparable to the PCR level detection. That's another key thing. And the third thing is minimal sample pre-treatment should be there. Especially whenever you go for sample treatment, pre-treatment processing, there is always going to be a bias. The results will lead to a misinformation. So, and also it should be amplification free. So whenever you do the pre-treatment of sample or amplification, that there is a possibility, especially in the early stage of detection, there is a possibility of misleading due to bias results. So we decided to use our in-house developed technologies. One is called SynBiomes, which we that is synthetic bio-nanoparticles from yeast as molecular probes. And the other platform, what we have is a microassay that we developed for detecting different cancer biomarkers or dengue virus biomarkers. So we developed an ultra-sensitive plasmonic nanobox integrated nanomixing technology based assay, which that is microassay. So we decided to combine this microassay with the yeast-based synthetic bio-nanoparticles to develop the SARS-CoV-2 detection platform. So we believe that this can be amplification-free and accuracy detection can be achieved using by integrating these two technologies. So first, let me tell you what is the synthetic bio-nanoparticles, which we call it SynBiomes. So here, SynBiome is nothing but a nanoparticle, synthetic bio-nanoparticle derived from yeast cells from the cell wall fragment. So here we use the yeast cell display system, where you can see. So this is the yeast representative yeast system, Saccharomyces cerevisiae. And in the cell wall, in the outer cell wall, you have an anchor protein where you can bioengineer through genetic manipulations. You can construct your own binder system, or any protein can be displayed on the yeast cell walls. So here we exploit the endogenous anchor protein to display our protein of interest. So here, for example, we generally display the SCFE proteins. SCFE proteins are fragmented antibodies where you have only the variable domains of full antibody. They have the same function similar to the antibody. That's the key thing. So whenever you make SCFEs on this Saccharomyces cerevisiae, which is nothing but the Baker yeast on the cell wall, and then so as you can see, this can be scalable, easily scalable by, we know that yeast production is very easy, cheap, and cost effective, and you don't need a animal injection or something like similar to antibody raising. This method is completely yeast cell based one, where you express the yeast cell with your target protein of interest like SCFEs and grow in a moss culture, and then just lyse the cell, and it's easy to separate the yeast cell wall fragment just by centrifugation, and thereby the yeast cell wall fragments with the SCFEs separate quickly, and then we use just a filter to get rid of the big size particles and end up with the nano size fragments with SCFEs, target SCFEs that can bind to any target molecule. So using this platform, we already demonstrated binding different biomarkers, including dengue virus. And the other methodology, other technology, which I said is ultra-sensitive plasmonic nanobox integrated nanomixing microassay, which utilizes gold microelectrodes. Here you can see an array of gold microelectrode, which is assembled in an asymmetric, asymmetric method. And also we used CERS nanotag. CERS nanotags are composed with gold silver alloy nanobox, which attaches the Raman signal generating CERS nanotags, nanoparticles, which is coated on the surface of the nanobox. And also we decided to use this high sensitive, the advantage of this CERS nanotag is they are reported to be used for detecting single molecule. Even a single protein can be detected using this CERS nanotag. That's the advantage of using CERS nanotag. So people generally use ELISA or other fluorescence or luciferase enzyme-based methods. They are not as sensitive compared to these nanotag methods, because this can detect in a single molecule resolution level. That's the advantage of using CERS nanotag. So, and also we also use nano mixing technology, which we developed in our lab in this microassay, where nano mixing is nothing but when you apply an alternate current electrohydrodynamic in the asymmetric microelectrode, there is a in the solution, it can make a mixing in a nano level scale. So that can help mixing the collision frequency higher, that can enhance the binding interaction with the target molecule and the and the antibody. So that way you can increase the sensitivity as well as the specificity to the target detection. So that's the advantage of this nano mixing. So combining all these things, our lab previously demonstrated this platform, the microassay platform for different biomarker detection. So here we thought, can we, since such nanotech can be used for single molecule detection, we thought, can we use this technology for detecting the protein-based detection of SARS-CoV-2, the spike protein, in an early stage level, which is comparable to the PCR level without amplifying the proteins. So here is the working principle what we developed. So as I explained, these are the components present in the developed microassay, where we use the nano size yeast fragments with SCFEs. Here, this is the one, and this is the patient sample with SARS-CoV-2 virus, and this is the CERS nanotag, which gives you single molecule detection level sensitivity signal. And then this is the architecture of the yeast cell wall fragment, where you have at the end the SCFE protein that binds to the target protein. And these are the different tags which we use for detecting, confirming the expression of the proteins on the cell wall fragments. So here is the, when you apply, I mean, when you add these samples with different components, here it is, and then apply the nano mixing technology, where you enhance the binding and detect it with the laser light, and you get the CERS readout, Raman spectrum. So here is the result, how it comes, the output. So this is the working principle we decided to test. So as a first step, we generated the nano yeast against the SARS-CoV-2 spike protein, the RBD binding, receptor binding domain. So that we took different antibodies and put the grafted the variable binding loops into the SCFE fragment, and we generated the different types of SCFEs. And when we started this project in 2020, we had only one antibody reported, which is CR3O22. This is one of the problems, because at the time there were no antibodies reported when we started. So we had to wait for a long time. Even though we had the technologies in hand, we couldn't test this platform to make sure this can be used for SARS-CoV-2 detection. So later, when people started reporting different antibodies, we generated these SCFEs in yeast, and we tested this platform in the Raman spec. So as you can see, when we tried different antibodies, most of them not functional because the sensitivity is, I mean, the affinity is not good. But one of the antibody, which is called S309, that has a high affinity for spike protein, and which can show very good signal in Raman spec. And also we used as a control the ACE2, which is the natural binder for the spike protein, which is present in human cells. So we use different panel of SCFEs, but only one of them worked. So to confirm how much S309 is expressing in the yeast cells, we did a FACS analysis. As you can see in the x-axis, it shows the amount of expressions of this S309 SCFE on the surface of yeast cell wall. That confirms the very good, almost 60% of yeast cells expressing the proteins, the target protein. And the y-axis shows the RBD binding. Here we tested the yeast cells, the expressed yeast cells with RBD GFP fusion protein. So when we add the RBD GFP, the signal goes up in the y-axis. So this plot confirms both the expression and binding efficiency of the yeast cell that express the S309 protein in the yeast cell wall. So by confirming this, we decided to try whether this can be detected in a dose-dependent manner. So we tried different concentration of the soluble RBD GFP protein. When we tried that, we could clearly see when we don't add any RBD GFP, there was no significant signal appeared. But when we slowly increase the RBD GFP, as you can see, the signal started significantly higher to the increasing concentration. So based on this fluorescence level, from this data, we calculated the binding affinity of the S309 protein on the yeast cell wall, and we could find that it retains the affinity in a nanomolar range, which is very high for detecting binding to the target antigen, especially the RBD protein. So once we confirmed that, we wanted to characterize whether what is the size distribution of these nanoparticles that we generated. So one thing is like the S309 nano yeast size distribution was confirmed in the nanoflow cytometry, which is like 75 nanometer. So here you can see the peak goes at 75 nanometer. So the average size of the nano yeast cell wall fragment, what we got was 75 nanometer. And similarly, the nanobox, what we generated to detect the SARS-CoV-2 virus, it appears like 76 nanometer. So this is the size distribution of the molecular probes, what we generated. So first we wanted to detect whether the generated nano yeast system, the nano size cell wall fragment can be applied in the gold electrode and still they retain the function or not. So as you can see, we tried two different methods. One is the physiabsorbance and the HA tag, because we have a HA tag in the target protein. So we immobilize this nano cell wall fragment using the anti-HA protein. So as you can see, compared to the physiabsorbance, which generally people use for any antibody immobilization on the surface, which is where people lose the antibody function. So similar to that, when we tried the nano yeast in the physiabsorbance, they didn't show any significant signal. Whereas when we tried with the HA tag based immobilization, it appears to be very good, giving very good signal, significant signal for detecting soluble RBD, not the virus. Still, this is the first confirmation that we could able to detect the soluble RBD in the microchip. So this is only like capturing the virus is possible using this system now. So, and also we functionalized both microchip as well as nanobox. In case of microchip, we use the nano yeast. In case of nanobox, we functionalized them with the polyclonal antibodies. So for detecting in a high sensitive way of virus. So most of the times when we do that, I mean, people generally try the microchip based methods, the signals are not reproducible. To demonstrate that this method is reproducible, we tried 5 different microchip and 5 different preparation of nanobox, and all of them appeared like they showed very good similar signal, which confirms that this newly developed method is reproducible. And also here we tried the nanomixing. We compared the detection of soluble RBD using both monoclonal antibody and the newly developed S309 nano yeast SAFEs, and both of them showed similar range of almost, there is no significant difference in the signal range. So which confirms that this could be a potential alternative for generating, I mean, as an alternative for a conventional antibody system, where you have very painful process to produce monoclonal antibodies. This system is very quick and cheap. So after confirming the possibility of detection, we wanted to check whether the signal what comes is really specific from the RBD protein or is something not non-specific. So in order to check that, we tried the RBD as a positive control, and as a negative control, we just used the buffer what we used for RBD, that is PBS buffer, and RBD from dengue virus. RBD is same for the spike protein, the SARS-CoV-2. The detection antibody, which comes from the nanobox, we changed. Here we have the poly RBD specific to SARS-CoV-2. In case of this one, it is same, but instead of target, we used PBS buffer. Here, in all cases, we use the target, but the nanobox is different. It comes with, the nanobox is same, but the instead of nano yeast, we use commercial antibody that is against the dengue virus, M396 or E2 or 2F5. Or, these are all the clones which we generated for the nano yeast SCFEs for dengue virus. So these different nano yeast that doesn't give any signal at all for binding to the RBD, which again confirms that the developed nano yeast SCFEs are very specific to the target the SARS-CoV-2 RBD. This confirms that our system is working very well and gives reliable specificity. And once we confirm that, we wanted to check whether this can be detected with the virus. The soluble, the previous result was only with the soluble RBD. It could be easy, but in case of virus, it may not be detected. So we wanted to check whether the system is capable of detecting the virus, the real SARS-CoV-2 virus. One problem we had was the patients on the real live virus, because here in Australian system is very strict. We can't use the live virus in the PC2 lab. It has to be in the PC3 lab. So we couldn't try the live virus. So first we started to try the gamma radiated dead virus to confirm whether the developed system is capable of detecting this virus part, dead virus. So as you can see, the same like previous slide, here this is the positive control where we have the nano yeast SCFE with S309, and these are all the nano yeast specific for dengue. So when we use the nano yeast against the SARS-CoV-2, it gives very good signal, whereas the nano yeast against dengue, they don't give any signal at all. So again, this confirms that the virus can be detected in our newly developed platform. So now the question is, what is the sensitivity range, which is the key question why we started this project? Because the problem with the protein-based detection system, the lowest sensitivity is the problem, where people can go 1,000 virus or more than 1,000. But in our system, as you can see, when we increase the virus particles in each microliter, actually this is the start, and we diluted to up to 0 virus per microliter. You could clearly see a linear increase of signal, where in case of 20,000 virus particle in a microliter, we could get very good high amount of signal, significantly high. Whereas when we go down in diluted samples, the signal goes down, and we were able to detect up to 17 virus particles in 1 microliter, which is not comparable to the, which is still not same as the PCR level, but the 17 is very close to the PCR level detection in a protein-based detection system, and without amplification and no processing of samples. So it could be a potential method where people can directly use it for detecting the SARS-CoV-2 from patient sample without any pre-treating the patient sample, or any amplification is not required. So here, the next as I said, like the previous slide is like we tried the the dead virus particles to detect, to confirm the platform is working or not. Now, in this case, we don't, in last year when we tried this, when we developed this platform, we didn't have any access to the patient sample, especially Australian quarantine system was very strict, and we didn't have much cases in Australia last year, and we didn't have any access to patient sample as well. So what we did, we just since we have a lab grown virus particle in a dead form, we just simulated the patient sample in a saliva sample. We added the known amount of virus particles, and and we tried the experiment. When we tried that, we could clearly see when the virus particle is high, we could get very high signal. When there is no virus particles added in the saliva, there is no non-specific signal, which means the saliva sample can be used in our platform without any cross-contamination or non-specific signal problem. So in summary, we successfully developed the yeast-based synthetic bio-nanoparticle-based detection system for SARS-CoV-2. Our system utilizes our in-house developed two different methods. One is the yeast-based Synbiome, as well as the ultra-sensitive plasmonic nanobox integrated microassay. And we utilize the yeast display technology, which helped to recently bioengineer a panel of SCFEs which targets RBD spike protein, and the highest avidity on yeast Synbiome, because as I showed, the yeast synthetic biofragment have multiple copies of these SCFE proteins on the cell wall. So they can we claim that they have more avidity effect in detecting the virus particle, especially in case of, as most of you know, that in the spike protein, it's not a monomer, it's a trimeric spike. So 3 copies of RBDs are there in the spike, in each spike protein. So especially the platform like having a nanoparticle with multiple copies of target binder, where they will have high affinity toward the virus particle like SARS-CoV-2. So which helps to detect in a very specific manner. And the nanobox what we used with the CERS nanoparticle, that helps to increase the sensitivity to detect the SARS-CoV-2 in as low as like 17 virus particles in 1 microliter. So this platform technology here, we confirmed that this can overcome the biased amplification issue when while doing the community transmission screening or in a population-based scale. So before concluding, I would like to highlight this was published last year in Analytical Chemistry, this work. As a follow-up, now we are moving to the next generation Synbiomes by further engineering. So in the directions, in the previous work, we Synbiomes, where you can see this is the cell wall, and in the middle you have the anchor proteins which is holding the target binder like SCFEs, and this is what we had. But now we extended the display to have some universal surface binder, where protein-based binder, where you can immobilize this synthetic bio-nanoparticle in different surfaces like plastic or silica or gold. The same Synbiomes can be immobilized in an oriented way in a different surfaces. That's the advantage. And also here we used, instead of SCFEs, in the previous paper, as I showed, like when we do a panel of screening, 1 or 2 and SCFEs are functional, but other than one S309, most of them are non-functional. The problem is because every time we have to, whenever you convert the intact antibody into SCFE form, you lose the function of the protein in a significant amount. So to avoid that, we decided to use nanobody instead of SCFE. So this is our new design, which we call it next generation synthetic Synbiomes. So, and we decided to use the same workflow to to use this symbiomes in our detection platform. So this is our newly developing symbiomes. We already have some results, and not only in cells, we tried this methods, this symbiome, the yeast-based symbiomes in different platform, like fluorescence based detection, or just electrochemical detection. Not just, I mean, this is label free. Just you can use it in the glucose sensor or some sensor like electrode chip, which comes with electrode chip with transducible reporters. And here, this is the lateral flow paper-based fluidic methods, where you can detect the SARS-CoV-2 in calorimetric or naked eye detection. So we are proving that this symbiome can be a universal probe. So it's still under research. I mean, like we haven't prepared the manuscript yet for this, so I cannot show you the data for this. But this is the overall scheme what we are doing currently for this, using this yeast symbiomes nanoparticle system. All right, thank you for everyone listening this talk. If you have any question, I'm happy to answer.
Thank you, sir. Over to the chat person.
Nice presentation, Silva. Again, we are very happy to see that you are moving into the biosensor, especially the paper-based and microfluidic-based sensors, and you are still using your SCFE in a right manner and putting in the right platform. On behalf of others, I have some questions, and I'm happy to learn from you.
Sure, please go ahead.
So one is like, what is the sample you used for SARS-CoV? Is it like a oral sample or nasal sample? Which samples you used?
Sorry, which?
You have generated a lab model for SARS-CoV. Am I right? Virus particle you used, am I right?
Yes.
So those samples has been collected from nasal or oral?
Oh no, the virus particle what we used for detection in this platform is lab-grown virus particles, where we culture culture means like within culture. Our collaborators, they culture the virus particles, and they kill the virus using gamma rays. So we get the dead virus particles, and we use it for test it in our detection platform.
Okay. So you mean to say that a virus particle, it is a virus, am I right?
It's a virus. It's a It's not a live virus. It's a dead virus.
So another thing, for Raman platform, if you want to use the Raman platform, whether we need any specialized instrument to sense your sensor?
That's a good question. Actually, that's one of the issue. I mean, even though, I mean, as I said, it has an advantage of detecting the target in a single molecule level. The problem with that Raman is you need a Raman spectroscopy. It's not portable. I mean, I'm not sure whether the portables are that sensitive, but you need a Raman spec which you cannot take it everywhere. So it's not quite useful. I mean, for research purpose, it's useful, but when you go for a ground level for a real application, we cannot rely on Raman spec. So that is the reason we tried this in our next generation. We are moving to the other platforms. As I showed, now we are able to use this yeast-based nanoparticles applicable in different platforms, especially as an alternative for Raman signal. We are moving to quantum dot based detection, because quantum dots are alternatives. They are bright, they are stable, and they are sensitive, comparably sensitive to single molecule resolution. We haven't done any publication for single molecule detection with the quantum dot, but currently we are working on to that. So once we are able to use the quantum dot based detection similar to CERS-1, then we can take this to the real-time platform. You know, like in a normal, you don't need a lab-based common spec. You can make a mini device with which can detect quantum dots optically, fluorescence. Then you can take the reading in your smartphone. You can put the chip on the smartphone, connect it in the USB port, and put your sample. Then you can read it in the app. So that's our dream. We are moving towards that. Yep.
Nice
Did I
to
answer
hear
your
that.
question?
Yeah, nice to hear that one. But the quantum field, the one thing what I learned that is the quantum efficiency. I mean, the fluorescent thing, the quantum field of that one. When you keep on using it, usually goes out. Yeah, but you know have the alternative strategy. Probably you're the expert on that. You can do that. What could be the cost which you are expecting? Because if I want to use your platform for a developing country like us, the cost is play a very important role. For example,
exactly.
Per sample now we are paying from 100 rupees to 400 rupees. Is it affordable?
Definitely, that is the main focus of our system. We don't know. I mean, we don't want people to pay so much for using the commercial antibody-based method, which is very expensive because we are also, I mean, for research purpose, we are also producing antibodies. We know how painful to make antibodies, and I mean, even the antibody discovery is painful. So, as an alternative, we are coming up with this system. At the moment, I cannot tell you how cheap it would be, but I'm pretty sure it will be significantly cheaper than the conventional antibody, monoclonal antibody-based system. Because in monoclonal antibody, you had to use the mammalian cell system. You need a special facility, and all the media, everything is very expensive. But in case of yeast, it's very easy to grow, and the media is very cheap. And in fermentation, you can grow it in a high density, and it can produce like mgs of proteins. It can secrete as well as it can attach to the cell wall. So our idea is, I mean, when you go, I mean, again, if it secrete, then you have to go for downstream process, purification, blah, blah, blah. So we don't want to do all the steps. We want to just generate, lyse it, use it directly. So this is the easiest way. And the advantage of having the target binders on the yeast cell wall is, as I mentioned in the last slide, you'll be getting multiple copies. So in case of soluble antibodies, they are individual one single copy. So you won't get avidity effect. So especially the virus, like detecting the virus like SARS virus, you need to have multiple copies of binder. Because the spike protein have primary copies attached in the surface, 3 RBDs on the top. So if you use primary, it's already published. People used primary copies of monoclonal antibody to efficiently bind the SARS-CoV-2. It's reported. So here you don't have to do extra things. It comes already when you express them in the surface. They already have multiple copies in the cell wall. So you don't have to make a primary copy, or you don't have to conjugate them. That's the advantage of this system. Yeah.
Okay, when you're talking about, because you're talking about the money and other things, there are two things that matter. When I could see that 17 virus per microliter. You mean to say that 17 copies per microliter?
17 copies of viral particle.
Okay.
I didn't mention. We confirmed this with the RT-PCR. So we quantified the amount of virus in RT-PCR. We know the copy numbers, and then we used that for diluting and calculating the number of virus we are able to detect. Yeah.
So here, because here there is a difference, I think you also maybe agree that there is a terminology called sensitivity, or it's a specificity. Because when you're using the break opening the cell and cell wall particles from yeast, although there are a lot of debris also come out, and there is a lot of chance that the specificity is going to be the matter. For example, what is the chance of making a false negative or false positive by your system?
Excellent question. I want to highlight, I mean, in one of my slides, I highlighted like not only the nano box, such nano box, we also use the nano mixing technology. That helps us actually. That's another unique thing what we use. So that helps to get rid of the specificity issue, non-specific issue, because it increases the collision rate, and also it also do the nano searing. Nano searing means it can get rid of the, whenever you do, I mean, you have non-specific binding, they are weak binders, they are not strong binders. So when you apply nano mixing, they just get rid of, due to the nano searing effect, the non-specific binding will be disappeared. So that's the advantage of using nano mixing in this platform. The other thing is like the synthetic bio-nanoparticle from yeast, they are not just crude extract. We lyse it, but then we do centrifugation step, where you get rid of the most of the junks, big molecules, and also we do filter to get rid of the bigger molecules. So at the end, we'll be having only the nano size fragment, which is less than, I mean, we use the 0.1 micron filter, which get rid of all the size bigger than 100 nanometer. So all the nanoparticles, what we have is, it could be anything. It could be, I mean, most of them are cell wall fragment. From our analysis, we characterized through functionalization, but most of them are like the cell wall fragment. Yeah.
The Raman spec, we could see you are expecting for the band at 1600, right?
Yeah, approximately.
But we could also see that your data, there is a predominant band at 1000 and 1200. Whether it is because of the non-specific binding or any specificity.
Okay, it's a bit difficult question for me because I started learning. Let me. I mean, like the point is like I'm a new person to search. I started doing this recently.
Fine. That's what one of my friend was working in Raman for a very long time in my colleague.
Sure.
So we usually just learning. I'm also learning from the
definitely.
So
yeah, I can clarify you.
Yeah, please.
Yeah, I can clarify you a little later after confirming with. Even I didn't notice. I mean, I'm not sure because whenever the data comes, because it's a teamwork with multiple collaborations. So I'm not a search person. I'm a protein engineering guy. Basically,
fine.
You know that.
Yeah, great. Yes, I was very curious to know that one. What's happening over there. So another thing is like we in India most of the time as a BSL2 facility, we conclude whether the SARS-CoV poison is positive or not or negative through by seeing the CT value. For example, ICMR has fixed that if the poisonous CT value is higher than 35 or something, although there is a virus particle, we can say that he is positive or not. But in the case of your technique, is it possible to say that the person is in which stage, whether he is in early infection or he is in the peak, or the person is really going for a stationary phase or something? Is it possible?
That is the main focus of one of the main focus of our work, because as I mentioned in my introduction, so RT-PCR requires amplification and pre-treatment of sample. Both of them will have problem, especially when you do in the early stage. So the other alternative is protein-based method, where people use serological method, which cannot be done in early stage because the antibodies doesn't appear. Antibody response doesn't appear in early stage. So detecting the spike protein or the viral proteins, spike protein or nucleic acid, these are the only available stuff in the early stage. So our idea is to focus, can we able to detect these protein protein molecules, the spike protein or nucleic acid in an early stage. So we haven't, I mean, for this paper, as I said, we couldn't get the patient sample, but very recently we got patient sample. We tested around 80 patient sample from nasal sample, and we confirmed the system is working very well. We got amazing specificity, 100% specificity and 100% sensitivity. But the problem is we don't know the patient data, which day the patient data was collected. We are still in touch with people to collect those data. But at this stage, I'm not sure whether our system is capable of detecting how early. I cannot say, but we are doing that work currently. Yep.
Yeah. So the last one thing, just for understanding.
Maybe I can add one more point to that point to that question. The thing is like how we claim that it is capable of use it for early detection, similar to PCR. The reason is the amount of viral load reported previously in every stage is close to 10 or 1,000 viral particles. So our system is capable of detecting at least 17 viral particle, which means we are in the range, detection range for the early detection.
Actually, what I want just want to learn is like we have the terminology called CT value. So where we can say that whether any values will be coming through your sensor to say that to quantify that one.
That's a good question. We haven't tested that.
Okay.
Because the problem, I mean, theoretically, one cannot compare the CT value which comes from RNA or RNA-based detection system. The protein-based detection system is different. In case of each viral particle, you have one copy of RNA. In case of protein-based system, each viral particle have around, I think each virus have 90 or I'm not sure, around 90 spike proteins, and each spike protein have 3 RBDs. So you cannot compare the CT value level with the protein-based detection system, but we are trying to find some correlation or trend based on the number of days in patient sample. So which day, I mean, again, it's not for sure because every person has their own level of immunity, so their response will be different. We cannot even say that. So yeah,
okay,
it's not possible, I would say.
Sure. Thank you so much for your presentation. And I think we any other questions from other people? I think if anybody have a question, please write to Dr. Silva. He'll love to answer all your questions and clarifications. Thank you very much, Dr. Silva, for your valuable time and for enlightening us with your new technology for point care medicine. Probably is very highlighted for the biomedical people who's working on those lines. Probably they have to think about in future hospital also how we are going to develop anything. Maybe there are so many variants are coming out. So we need a specificity, sensitivity, so many things we have to answer. So probably this could be one of the enlightening to the researcher who is working on those areas. Thank you so much. I will hand it over to my co-chairperson to conclude those remarks.
Thank you, sir.
Thank you, Dr. Durai.
Thank you.
It's nice to see you after a long time.
Yeah, me too.
Thank you, Dr. Selva Kumar, for choosing such a hot topic, and it was a privilege listening to you, sir. We are very happy to honor Dr. Selva Kumar Edward Raja. Thank you, sir.
Thank you. Thank you so much.
Thank you, sir.
I would like to thank all the organizers, the institute people for inviting me for giving a talk in my research work. Thank you so much. Yeah.
We are honored, sir. Thank you. We thank Dr. Ayadurai, our chairperson, profusely for chairing such an insightful session. BMSC Con takes immense pleasure in honoring you, sir.
Thank you so much, ma'am, for giving this opportunity to chair the international conference. I thank you everybody of the conference people. And I also thank Dr. Ravi for suggesting me for this wonderful topic to chat. Thank you so much, Ravi, and other team members.
Thank you, sir. I thank the speakers and the chat person. And now I'll give it over to Dr. Sibi for the next session. Thank you.
A very good morning, and I would like a very good morning to all the delegates, speakers, as well as the chairperson. And now today's talk, the next talk is going to be on competency-based medical education to outcome-based education, the means to attain higher level of Bloom's taxonomy. And we have with us to enlighten on this topic a very renowned speaker, Dr. Akila Prashant ma'am, Professor, Department of Biochemistry, and the Head of Genomic Medicine Department from JSS Medical College, Mysore. And equally, we are so proud and we're honored to have an esteemed person who is chairing this session, who is none other than Dr. Vishnu Bhatt sir, who is the Director of Research of ABMC, Puducherry. And I welcome both the speaker, Akila Prashant ma'am and Vishnu Bhatt sir. Thank you for accepting our invitation to give a talk as well as to chair the session, sir. Now, it's my pleasure as well as it's with a lot of pride I have got a chance to introduce the chairperson for this present talk. That's none other than Dr. B. Vishnu Bhatt sir. He presently holds the position of Director, Medical Research and Professor of Pediatrics and Neonatology, ABMC, Arubade Video Medical College, Pondicherry. And coming to his prior experience, he did his undergraduation and post-graduation MD in pediatrics, both from JIPMA, and he has worked in various positions, designations in JIPMA, starting from senior resident, assistant professor, associate professor, and he was a professor and the head of department. He headed the Department of Pediatrics too. After following that, he has headed even the Department of Neonatology, JIPMA. Then he was promoted as Dean of Research in JIPMA, and he has even held the highest position of JIPMA as Director of Jawaharlal Nehru Institute of Postgraduate Medical Education Research, Pondicherry. Next slides. Now coming to his additional qualifications, sir, he holds a WHO fellowship in basic MCH care from Nepal and Thailand. He also holds a WHO fellowship in neonatology at University of Illinois, Chicago, USA. And he is the core faculty of the esteemed National Teachers Training Center, NTTC, JIPMA. And coming to his research and publications part, sir has 382 scientific papers. He has written all around 60 chapters in books, various books, edited a book on protein energy malnutrition and a book on NICU protocols in JIPMA. And he's associate editor for the journal. Coming to the awards, he has got the best internee award and best outgoing student in the school level itself. And sir has got the best scientific paper award in JIPMA Scientific Society thrice. B.R. Santana Krishnan Award for the best paper in Tamil Nadu IAP. Orations many, like National Neonatology Forum in 2013, Oration of JIPMA Scientific Society 2014, Raj Neocon Oration 2016, Award of the NNF Fellowship 2014, Internal Oration during JIPMA Research Day 2017, and he has even been given the Internal Oration Award by our Vinayaka Missions Research Foundation, Shanmugasundaram Internal Oration Award in AVMC 2 recently. Next. So over to you, sir. Vishnu Bhatt, sir, it's all yours.
Yeah, good morning to everybody. Thank you, Dr. Manju.
Thank you, sir.
We can see Dr. Akila Prashant also. She has not kept her video on probably.
Ma'am,
So she is a
Akila ma'am, I would request Akila ma'am to please switch on your video, please, ma'am.
Ma'am, my video is on, ma'am.
Yeah. We can see you. Thank you, ma'am.
Yeah.
so it is very my privilege to introduce Dr. Akila Prashant, whom I have not met physically, but she is a multifaceted person. She has done her MBBS from Mysore University and MD from Manipal. Later, she did her diploma in genomic medicine and healthcare from University of South Wales. She had done PhD from JSS in 2018. She worked in Pokhara, Nepal, in the biochemistry. Later, she shifted back to JSS, and she has been occupying various positions. And presently, she is the head of the Department of Biochemistry and Medical Genetics. She has got several awards, like to mention a few: Professor Tatachari Endowment Award, Women Achiever Award, Best Oral Poster Presentation, and several other awards. And she has organized several molecular diagnostic technique workshops all over the country. People must have attended. And she has developed the genetics lab in JSS with all cytogenetic facilities like karyotyping, fish techniques, and special interest in human genomics. She's also started screening for metabolic disorders and presently guiding about 7 PhD scholars. And I'm sure that she is also in the Department of Medical Education, because she is going to talk to us on competency-based versus outcome-based curriculum. Any research and education is like fashion. So it keeps on changing. You come to a new method, then you go to the old fashion, then again it becomes new. So we keep on changing because people will never be content with where they are. And I'm sure that her talk will be enlightening the participants and looking from competency to outcome will take to a newer height. So the outcome should be much better. Ultimately, what we should see is the students or the graduates who come out do the best in the situation wherever they are. So I request you to deliver your talk. The stage is yours, Dr. Akila.
Thank you very much, sir. Thank you for the kind introduction from a renowned person. I thank the organizers for giving me this opportunity, and I start sharing my slides.
I think you should be able to share the slides.
Yeah, I hope the slides are visible.
Yes, ma'am.
Visible.
Thank you for this opportunity, and I'll begin with the presentation. So since I'll be talking a lot about learning outcomes, so I thought I'll start with what would be the outcome of this particular talk. So we'll get a brief idea of what is competency-based education. I've kept it very minimum because most of us are already following this in our medical colleges. So what I would focus more on would be the outcome-based medical education, and our experience during the pre-COVID era, how we used to go about with the follow the outcome-based medical education, and during COVID, how we switched over to some online modes, and what are the benefits and some of the challenges which we faced while adopting to the outcome-based medical education, and finally take-home message. So coming to the overall scenario of the higher education system in India, it is since age old. Like India has always been a center for advanced learning, attracting students from all corners of the world. And we have undergone a rapid progress, a remarkable expansion, but still not up to the mark, but still we are much better. We've crossed the threshold of 15% of the gross enrollment rate over time. And now we have reached up to 30%, which has to increase even more than this. But this rapid growth and expansion in Indian higher education system has resulted in various quality problems, and we have many regulatory bodies. Like for the medical education, we have the National Medical Commission, which was earlier the MCI. They have taken several measures so that the Indian medical education is at par with the global standards. And to name a few, the recently introduced competency-based medical education is one of the steps which the MCI has taken to so that our education is at par with the global standards. So competency-based medical education, as we know, it is an approach that allows the students to advance based on their ability to master the skill or the competency at their own pace, regardless of the environment. So it is not the grading scale what we used to follow earlier. It is everybody attains a certain level of competence, and they can attain it at their own pace. Some may attain it faster, some attain at a slower rate. So this method is tailored to meet different learning abilities and can lead to more efficient student outcomes. So that is with which the MCI has introduced this to the medical education also. So why was it required? Because the medical education system was based on the curriculum that was subject-centered and time-based. So it was more of one-way lecturing, which was going on all these years. And the evaluations were summative, and
your voice is breaking it.
Yeah. Okay, can you hear sir now?
Yes, yes, ma'am.
Okay. So we had very little opportunity for feedback as such. So the feedback was as such not taken from the stakeholders. Also the learning, teaching learning activities and assessment methods, they mostly focused on knowledge rather than the attitudes and skills what the students had. And thus the graduates had a lot of knowledge, but they lacked basic clinical skills which were required when they actually entered into clinical practice. And also the soft skills. I mean, there was no assessment kind for assessing their soft skills and the doctor-patient relationship, ethics, professionalism. So these were some of the things which were lacking in the earlier system of medical education. So now coming to the CBME, how this was different from the traditional method of education which we used to follow. Here, the driving force for the curriculum was the knowledge acquisition in the traditional model. When coming to the CBME model, it is mainly on knowledge application, how you apply this knowledge, whatever you're studying, and why you're studying this. And driving force for the process in the traditional mode was the teacher, and in the CBME mode, it's the learner who is the driver. Most of the things are like self-directed learning is what we follow now. And there was a hierarchical pattern in the traditional mode, whereas here we have a non-hierarchical pattern. That is, it is not the teacher who is teaching the students. The small group discussions which there will be exchange of knowledge which happens during this mode of teaching. And the teacher alone is not responsible. Your teacher and students both are responsible. And even coming to the assessment methods, assessment is not only on the end semester examination or something. It is in case of CBME, it is continuous assessment which is happening. And I mean, some of the scenarios, case scenarios, when you take or the auspice stations, what we have in our biochemistry practicals as such. So they are kind of mimicking the real life scenarios. And it is not just the proxy thing which goes on during the assessment at the time. So more emphasis is based on the formative assessment in case of CBME rather than the summative assessment. And yeah, the program completion is still fixed time. We have no option for variable time CBME. I mean, in the CBME, we've still not adapted to that. We still have the fixed duration for the program what we follow. So main components of the competency-based medical education, there are 5 core components which the competency-based medical education is based on. So it's a clearly articulated outcome competencies required for practice. So whatever outcome is to be clearly defined for each and every learning activity they do. And the sequenced progression of the competencies and development marker. That is, we have to set certain milestones and at a sequential way. So how these students will attain those milestones. And tailored learning experience that facilitate the acquisition of competency, and competency focused instructions that again promotes acquisition of competency, and assessment is also based on these outcomes. So how the outcome has been attained. So in going in detail with these core competencies, so this the core one, which I was telling about, the articulated outcomes. These desired outcomes of training are identified based on the societal needs. So what is required for that, for our society, and that should be the outcome of the graduate who is graduating out of the medical school. So in practice, how we can do it is the required outcome competencies are based on the profile of the graduate and the practice-based ability. So we have to define these outcomes based on what you're expecting out of the graduates. And why this is done? Because this specification of the learning outcomes, it promotes focus and accountability. When the student knows that what is expected out of him, so he is accountable for attaining these outcomes. So in detail about core 2, the competencies that are developmental markers are sequenced progressively. So that is how we do it in practice, is the competencies are organized in a way that it leads to a logical developmental sequence across the medical practice. So each competency should help him attain a higher level. So that way it has to be sequenced. So why we have to do this is that this kind of supports the development of expertise. So the student, he or she also knows like what is expected during the first year, second year, third, and finally when they come out, what is expected out of them. So coming to core 3, the learning experience facilitates the developmental acquisition of competency. So in practice, this learning takes in setting that the model practice, I mean, it is flexible enough to accommodate the variable individual learners. So suppose if there's a person who is not able to attain it at a particular stage, so there will be remedial measures taken for this particular student and how we can make the student attain the competency. So through this, the learning through real life experience, it facilitates the membership into the practice community and developmental of competence. So the student also has that motivation that he has to attain this particular outcome during this period of time. So core 4, that is teaching practice, promotes the developmental of acquisition of competency. So teaching is individualized to the learner here. So that is based on the required progress, how much the student has made the progress, based on which the next teaching activity is decided. So in principle, this developmental competence is stimulated when the learners are supported to learn at their own pace and stage. So they have that flexibility to learn at their own pace, but this is a little difficult to follow in our Indian setups that I'll be discussing in the end. So assessment practices assess and document the development of acquisition or competency. So finally, when the assessment is done, so we have to also measure whether that particular competency has been attained. So how this can be done by direct and indirect ways is some of the methods which we have adopted in our institution, which I'll be discussing in our experience level there. So that was about competency-based medical education. So I shift gears to outcome-based medical education. This outcome-based medical education is not very different from the competency-based medical education. There's a lot of overlapping, but There's something which is more than the competency-based medical education. So outcome-based medical education is again student-centric, like the CBME pattern, teaching and learning methodology in which the course delivery assessment are planned to achieve certain objectives and outcomes. So that is again how we do in competency-based medical education. So it focuses on measuring the student performance and outcomes at different levels. So here we have different levels at which we measure whether there is the outcomes have to be defined earlier, and then we measure whether the outcome has been attained or not. So it has all the characteristics of CBME as such, along with understanding why that particular competency or proficiency matters. So it is little one step or two step more than CBME. So important aspects of OBMA is, first we need to understand what is a course and what is a program. So course, as it is defined as a theory or practical, or both theory and practical subject, which is studied in a semester. For example, if we take into consideration the medical education, so each of the subjects what they study, that becomes a course. So course outcomes are the statements that describe significant and essential learning that the learners have to achieve at the end of that particular course. So generally, 3 or more course outcomes are specified for each of the course based on the weightage of that particular course. Program, as I said, it's defined as a specialization or a discipline of a degree. That is what is the student graduating as. So it is interconnected arrangement of various courses, curricular or extracurricular activities to be accomplished with all the objectives what has been defined for awarding the degree. For example, MBBS becomes a program and each subject becomes a course in that. So program outcomes, they are the narrow statements that describes what the student is expected to be able to do at the by the time he gets his graduation. So these program outcomes are expected to align closely with the graduate attributes. So these graduate attributes are also defined for every institution as such. So we also have program specific outcomes. These are the outcomes what the students should be able to do at the time of graduation with reference to the specific discipline as such. So this becomes a program specific outcomes. And program educational outcomes, these are again statements that describe what the student is expected to achieve after the graduation, and also in particular what the graduates are expected to perform and achieve during the first few years of graduation. And graduate attributes, which I told earlier, they are the examples of attributes expected of the graduate from an accredited program. So each of these has to be defined because we have to map it to each other. So there is a hierarchy which follows for all these outcomes. So these outcomes follow a hierarchical pattern. So at the university level, every university has a mission and vision. Vision and mission, everything is defined because as per UGC or as per NAC, this has to be defined for every university level. And based on this, the expected graduate attributes are defined for the particular university. The program education objectives describes what the graduates are expected to attain within the 5 years after the graduation. So that again has to be defined by the program at the program level. And there's program specific objectives where each program run by that university should have program specific objectives. And then the course level objectives, what I mentioned, the learning outcomes, what the students need to demonstrate at the end of the course. So each one of these have to be mapped to each other. Okay, so all the course outcomes put together become the program specific outcomes, and program specific outcomes put together become the educational objectives of the university. That put together becomes the graduate attributes which the university expects out of their graduates. So for example, if we take our institution, the vision of our institution is to provide leadership in medical education, research, and contribute to humane and cost-effective healthcare. And mission is to provide and provide a breed of globally competent medical professions with a strong urge to serve the humanity with core values of sincerity, passion towards lifelong learning, meaningful research, and patient care guided by ethics. So based on this, we have defined the graduate profile. So graduate profiles are as such descriptions of knowledge, skills, and attitudes which the university intends that the graduate will develop through their study to equip them to the future world. So these descriptions are written at the institutional and qualification level and used to inform the curriculum design. So the person who's designing the curriculum should be informed of these graduate attributes so that they can incorporate all this when they are designing the curriculum or designing the teaching learning activities and also defining the program specific objectives. So the graduate attributes in the outcome-based medical education, what we have defined is the graduate who is graduating from the MBBS program should be able to diagnose and manage health and disease relating the normal and deranged structure and function of the human body, recognize, manage emergency health situation and take preventive measures, recognize certain outbreaks and epidemics at various levels and take appropriate actions, or carry out the basic medical legal procedures and perform the post-mortem examination, apply principles of behavioral ethics and professionalism in the health and promote peace, and use statistical methods and demographic data in his practice. Also function as an effective member or leader of the health team and in different roles, and carry out research studies, demonstrate self-learning and be a lifelong learner as such, and should be able to counsel and educate the patients and families with empathy in English or with the local language, and also implement health promotion and educational activities and prevent illness and disability at individual or community level, and use informative technology in learning and practice of healthcare. So all these attributes are again in line with the vision and mission of the institution, and the program specific outcomes as such is built in again with respect to what is expected out of the graduate. So here again, he should be having a sound scientific knowledge of medical practice, be able to manage the patient, health promotion and disease prevention he should be able to do. He should have teamwork, work in a team and have the leadership qualities. And also he should master with the clinical and procedural skills. He should be able to perform the medical legal work and also be a good communicator and have interpersonal relationship, good interpersonal relationship. So based on which the biochemistry course outcomes have been, it has been defined so that each level of, as the progress, the overall outcome would be in line with the program specific outcome. So I just, here I've just listed out some of the biochemistry course specific outcomes which we have defined in our syllabus. So this way you can see that outcomes which have been defined by the institutions based on the mission and vision which defines the graduate attributes, they kind of should be mapped to the program educational objectives, which again to be mapped with the program specific outcome and student outcomes, that again to be in line with the course outcomes, course learning outcomes. So we will be responsible for this course learning outcomes, and we need to plan this by how we are going to frame the syllabus, what teaching learning methodologies will be utilized to achieve this particular outcome, and how we will assess the assessment will be conducted, and how in the assessment we will assess whether the student has attained this outcome or not. So that way we can measure the course outcomes, the program outcomes, and the institutional overall institutional ranking. Everything depends upon all these kind of assessments what are followed and how we measure these assessments. So based on that, we can take improvement steps. So whatever, suppose if we feel that the outcome has not been achieved, then certain improvements can be made on the various aspects, and we can again reassess whether it has been attained or not. Also, during the planning stage itself, we can take feedbacks from the parents, students, or anything new has been introduced. Again, feedback and inputs from the stakeholders can be taken, and we can improvise on the entire OBME framework. So teaching learning approaches are very important when we're talking about the OBME. So outcome-based teaching learning approaches are focused on not what the teacher intends to teach, but it rather gives emphasis on what the outcome from the learner is expected. So based on that, we have to teach in such a way that the outcome is attained. So teaching learning methodology should align with the outcomes, and the educational domain of a particular learning outcome is triggered by the various teaching learning methods what we use. So I'm sure most of us will be familiar with the big theory of constructive alignment, where all these are interrelated. What outcomes we have defined, based on these outcomes, our teaching learning methodology should be in line with the outcome, and also the assessments should be assessing these outcomes. So it has to be planned in such a way that all are interrelated to each other. So for the implementation of OBME here, at every level, we have to again re-emphasize or tell the students or tell the stakeholders that these are the outcomes what are expected. So we cannot keep them blind as such without telling them that these are the outcomes which you have to attain at the end of this particular. So every class also what we conduct, so we can define in the beginning that at the end of this particular class, this would be the outcome. So this is what is expected from you. So during the implementation, we have to explain to the students at the start of the term or at the start of every class that they should address to the learning outcomes, and all the learning activities should be aligned to the learning outcomes. So also we teachers should also refer to the syllabus every time we take plan a learning activity, because we have to see that at the end of this particular activity, what is the outcome. So always refer to the syllabus and make sure that the teaching learning activities and the assessments are aligned with the learning outcomes. And also the regular training programs from the medical education units will be conducted. So even the basic course what we have attended, as well as revised basic course, so they all are re-emphasizing on the fact that we have to stay abreast with whatever changes have been happening in the medical education recently. So we can use various learning activities to develop the students' interest in the classroom. So not only the didactic lecture, but various other large group teaching methods or the small group teaching methods can be utilized so that the students stay interested with the topic and explore creative ways of delivering the course content. And also design the once you have done your teaching learning activity, then it also becomes important to assess whether that particular outcome has been attained by the student or not. So we have to plan the assessment so that their skills, knowledge, and behavior, everything is assessed so that your outcome on the whole is being achieved. Also, we have to measure the outcome regularly. So regularly assess whether the learning outcomes have been achieved or not. So there are several parameters on which it is measured. So that also becomes important for us to know whether it has been successful or not. So teaching learning methods, from morning we are hearing like there are many methods. So there's some of this which have listed here, but there are many more methods which can be adopted, because the first lecture in the morning what we have heard did enlighten us on new things what can be introduced in our teaching learning methodology. So some of them like group discussion, case-based learning, problem-based. I'm sure most of us are doing this in our institutions these days. So some of the methods which we used to follow in the pre-COVID era, because where there was no restrictions as such. So there was PBL sessions, which we had, small group discussions we had. In the large group, we adopted the mind mapping methodology. Also, we use Kahoot for assessing whatever whether they have attained the knowledge or some of these things, and skills were assessed. We were taught to the students how to perform certain procedures. Demonstration was done. And we also had orientation of the students towards the molecular techniques through visiting our research lab. So where they were demonstrated of how to do a PCR and how to perform the Western blotting. So they had a real time experience with these methodologies. So they also understood why this is done and how it can be done. Okay. Without, I mean, just the theoretical knowledge would not have been sufficient for them. So in small groups, we had taken them to the molecular lab as such, so that they can experience the methodology in real. And also we had an activity of model making. So the students were divided again into small groups. Certain topics were given to the students and they came up with very interesting models. These models actually did surprise us, thinking that, okay, we can even teach biochemistry in this way. Because that was a very, I mean, it was a very good exercise even for us by seeing the models what the students had prepared. The one, if they also did a puppet show for the model wherein they described how a rickets child having rickets, how the child is born, how he develops, symptoms are shown on the child, and many things which actually amazed us also. So there were some publications which we came up after each of these learning activities, what we have, given to the students as such. So this was one of the publications where the experience of the students after they visited the molecular biology lab and saw the techniques of molecular biology, and what was their experience out of, what was the feedback from that. And we also analyzed their way of answering these molecular biology questions before and after they visited the lab. So that was one, the impact of experiential learning among the medical students. So that was one of the articles which we had published. And then during the COVID pandemic, everything changed. We couldn't have these kind of small group discussion in person as such. So everything shifted on to the online classes, online theory classes. We did conduct online EC session, early clinical exposure also was conducted online for the students. Case-based discussions, small group discussions with the Zoom breakout rooms was conducted. And as a self-directed learning activity, we had given certain seminar topics for the students, and we used a Zoom breakout classroom facilities, and each of the faculty was in charge of one particular room, and the students presented the topic. So this, it was, we have 200 students in our institution, and believe me, every student did present the seminar, and Zoom was a real good platform for us to, have this kind of an activity. And even the EC sessions we carried out on the Zoom breakout classrooms. So once, as I told you, feedback is a very important aspect of each learning activity we do. And after any of these kind of activities, what we perform for the students, feedback is collected from the student. So we did collect and analyze the feedback on the online classes which we had taken, so that it will help us also improve on what we have done to the students. So are they satisfied, or do we have to modify the way we are delivering our teaching learning methods should be altered. So this feedback what we received from the students were quite encouraging, and they did give us few suggestions. Those suggestions were also incorporated for our next session. So that was about the teaching learning methods. So coming to assessment, so assessment again is very important because it drives the learning. So we have to plan our assessment also. So assessment strategies and methods must ensure that the knowledge, skill, and attitudes set out previously are sufficiently covered during the assessment time. And it's a systematic process of measuring and providing feedback on the candidate's progress. So even during the PBL sessions, what we used to keep a feedback form with us, and each student's performance was recorded in that feedback form. So there and then we used to give those feedbacks to the students and how they can improve on their activity. That also was told to the students. So formative and summative assessments with various assessment methods can be designed in the MBBS curriculum itself to confirm the achievement of this learning outcome and the program outcome. So the choice of the assessment method is mainly based on the learning objectives and what kind of level of learning you expect out of the students. So this triangle, I'm sure most of us are familiar with the Miller's prism, and here it is, like the nose knows how, shows and does. So what you want to measure out of the student. So if it is just no, then it will be just the traditional way of the question answers, MCQs. If it is know how, then it will be interpretation and applications kind of questions which we have to ask. And if it is shows, then it is the OSPI and some simulations which the student has to perform. And does is where you actually assess in the workplace. So now EC gives us a very good platform for us to assess the does component also. On the logbooks, what the student maintains, that gives a total, it is concise way of shows us how the student has done what during his curriculum, the 1 year of studentship, what he has been with us. So some of the assessment methods which we followed pre-COVID and during the COVID era. So pre-COVID, we had the objective structured practical examination stations. So various stations were designed, and each station had a particular checklist, and the students were informed prior what is expected out of them. So, and whatever the student does, each step by step was marked in the checklist, and it was scored accordingly. So the student also knows that these are the steps which are expected out of him. Like for example, checking the capillary blood glucose using a glucometer, or urine dipstick methods. So there were various this which they can use in the real scenario. So most of the outdated experiments were not used in the OSPI stations. We try to keep the latest ones, like the newborn screening card was kept, and they were asked what are the different disorders which can be diagnosed with the help of this filter paper. So Guthrie's filter card. So these were the different OSPI stations which we have designed, and each OSPI station has a checklist in which we mark the student's performance. And during the online mode, that is during the COVID period, then again the breakout rooms came to our help, and we did conduct what is called as online objective structured practical examination, where the student didn't perform the experiment as such, but they mentioned to us each of the steps what is to be performed. So definitely, at home they cannot do the experiment as such, but at least we wanted to know whether they had an idea of how it is done and what is expected out of them, and how do they interpret some of the results what they obtain during their OSPI stations. And also the formative assessment also was done through the breakout rooms. I'm sure most of the institutions would have done this. And again, as I told you, we take feedbacks and analyze them, and some of these were published. That is one of the papers what we published of OSPI was how this OSPI helped in improving the students' performance. So the batch without OSPI, that was previous, we have been introduced OSPI since the past 3 to 4 years. So the batch before that, how they had performed, and the batch with OSPI, how did it perform. So the comparison between the two batches was done, and the data was published. And we also uploaded a preprint version. This is not published yet. It's a preprint version of the online practical assessment which we had. So how it helped us to assess the students' competence. So as I told you, online feedback is collected whenever we do any kind of learning, any kind of teaching activity or the assessment activity. The feedback is collected, and the feedback was quite encouraging for us. This feedback was based on the online practical assessment which we conducted for the students. So they were satisfied. Of course, they were missing the offline classes as such, and they did want everything to be repeated when they came offline. So that also was done, because that was a suggestion which was given to us. And we did all these practicals were repeated when they came to the offline classes. So as I told you, we have defined the outcomes. We have done the teaching learning activity, assessment is done. So how do you measure whether that outcome has been attained by the student? So there are direct and indirect ways to measure the outcomes. So direct way is the one which we have done, which I'll be explaining, but indirect one we have not yet done, but we thought we'll be doing it for the next batch of students. So it's just surveys and questionnaires which are sent to the students and taken feedback from the students. So it becomes an indirect way of assessing the outcomes. So direct ways that throughout the course, the performance of the students was assessed with continuous assessments, like either it be their seminar presentations, the PBL case presentations and discussions, what they used to have, early clinical exposure, how they participated in the discussion there. So everything was assessed periodically, and we had the internal examinations as well as unit tests, what we give to the students after the end of each topic. So these continuous assessments where we have to ask questions based on the learning outcomes. So that is very important. So we have to keep the learning outcomes in mind, and all the questions have to be framed in such a way that it does help us assess whether the learning outcome has been attained or not. So the continuous assessment, what was done for the students, so where the questions related to the course outcomes were asked, and accordingly the marks were allotted. And at the end of the year, the internal assessment and the continuous assessment marks were combined to a total of 100. And then the marks were recoded as such. So the person who, attained marks between 1 to 20, they scored 1, 21 to 40, the score of 2 was given, 41 to 63, 61 to 84, and 81 to 105. Then the average was taken, and this is a way in which the direct assessment of the outcomes are done. So because the questions are based on the outcomes, then this would be helpful for us to assess the outcomes, how much marks they score for that particular question, so that you can assess whether they have attained that particular outcome. So these are the this was the data which we actually presented during our internal audit. So the
Can we try to cut short, madam?
Yes, yes, I finished. So this was the various direct, we can see that the direct measurement of the outcome for the MBBS program was 4.16, and that was quite good out of 5. And other programs, what our department offers, so there was various outcomes for this also. So we know where to focus on and how the students are attaining these outcomes. So, so ending with the benefits, so this OBME can, could help us shorten the time needed for the training of the learners, but this cannot be done for the MBBS as such, but other programs, this can be adapted as such that if they attain the outcome earlier, they can progress to the next level. And it definitely requires rigorous assessment of the students, and it helps the student also have a greater confidence. And here OBME method helps, it assesses the quality of all the graduates individually. And the individualization, what we have in OBME method, it also helps the students to get motivated and progress better. And the assessment also is helping us to assess the outcomes better. So challenges is that the time required for all this planning and implementation of this. So it will kind of increase the time required for the weaker students to get experience with this learning objectives. And also the flexibility, what is talked about in the OBME cannot be implemented in our medical setup, such as in the Indian scenario. So it is still a long way to go for that. So, and the limited number of faculty, what we have, and the financial resources, what we have, also limits the potential of this, OBME. And here, since the student takes the ownership of learning, then it becomes challenging for few of the students to cope up with this stress. And faculty also might feel that they are not having the full control over the students. So that is also one of the drawbacks. So these are some of the challenges which have to be overcome for the outcome-based medical education as such. So the take-home message from this is that this is definitely a significant challenge which is involved in implementation of such a revolutionary change in the educational perspective. And small-scale pilot studies are feasible with limited portions in the curriculum that we tried and implemented. So it will gradually kind of percolate towards to various institutions and to a larger level. So it still requires time for us. Of course, the NMC now has taken all measures. Our competency-based medical education is having certain components of the outcome-based medical education, which we can explore, and the individual faculty members, institutions, and the programs, various programs can take up this activity, and definitely there will be a lot of improvement for the students, and the students will definitely benefit out of this. So this is all what I wanted to tell. Sorry, I think I exceeded the time.
Thank you, Dr. Akila, for a very nice talk on outcome-based curriculum. Curriculum cannot be static. It has to be dynamic, as you rightly put it. But of course, as far as medical curriculum is concerned, we have limitations, you rightly said. We cannot change without the medical council, whether it's a national or medical council of India, whatever it is, that it has to be changed by them. But internal change is possible. See, you can always try to improve the outcome. So we say about portfolio for competency based. So how do actually you record outcome achievement other than observation? Do you record that?
Yes, so that is what I mentioned about measuring the outcomes, how to measure the outcome which have been attained. So that was a direct and indirect methods. So indirect way is by the survey, what has been collected from the students, their feedback. So that based on the assessment and the outcome, whether they are satisfied with whatever outcome is being defined in the curriculum and whether they have attained that outcome. So indirect way of doing that would be collecting the surveys and feedback from the students. But direct way is that suppose if during our assessment, we have to frame questions which are related to the outcomes, and then how the student performs in that, whether it's a practical or the theory. So how the student has described the, explained any case scenario or whatever questions we have asked, how we have described, what marks he has scored for that. Or if it is a practical session, and how he has performed that practicals. So based on that, whatever marks has been scored is been tabulated, and then it is average is taken so that we get to know in a scale of 5 whether it is a good performance or a bad performance. So if he has, the average comes up to 4 and above, then definitely it's a good performance by the entire batch of students. Suppose if it is less than that, then there is definitely certain steps or measures which have been should be taken by the faculty so that all the students come up to that particular level.
So one of the major issues I think people are facing is the increasing number of students. So you make 50, 100, 150, 200, 250. Now, I am sure that in another 3-4 years, we'll be having 500 students. So with the limited number of faculty, how to manage them, that is one of the major issues.
This is a very big challenge.
Training of teachers is much more difficult, I think, because they should first learn how actually it should be done. So I think it has to go simultaneously, the teachers training and the students training. Otherwise, we say about observation, checklist and all that, there should be somebody who actually does it. Otherwise, you have to use the peer group or some other people to observe and use a checklist or that type of thing we may have to devise. So theoretically, it becomes very nice to listen, and but in practice, sometimes it becomes difficult.
Yes.
So we have to find a alternative method to assess whether what we want to do has been done or not. I think it was a very good talk. There was one question in the question box. Are the graduates attributes to different programs? That is, the university has MBBS, PPT, nursing. Would there be 3 sets of graduate? Obviously, it should be there, I think.
Yes, sir, yes.
Because I think what you have shown is other than medical course.
Yes, sir.
So each course has to have, because their ultimate outcome will be different, what they have to perform. So obviously we have to do have this. I think there will be many more questions. I request all of you to put the questions in the chat box, which can be transferred to Madam, and she will be very happy to answer the questions, because I think the next speaker is already ready. So we may have to close because time is limited. So
Yes.
thank you very much, everything. I will hand it over to the organizers to conclude the session.
So thank you very much for this, sharing your experiences, even sharing with us the challenges that we are going to face to make our CDME little more to an outcome-based medical education. So thank you very much, ma'am, for this insightful talk also. And I thank Vishnuvat sir for his valuable time in sharing this session too. So we would like to honor first speaker Akila Prashant ma'am with one virtual certificate and a trophy, ma'am. This is for you, ma'am.
Thank you.
Next, we would like to honor Chairperson Vishnuvat sir. These are your virtual certificates, sir and ma'am. Originals will be reaching you. Thank you very much, both Akila ma'am and Vishnuvat sir, for this session. Thank you very much.
Thank you. Thank you.
Thank you.
We both thank you.
Thank you. I would request the next moderator to take up and continue the session.
Okay, ma'am. Okay, ma'am.
Okay, Sudhakar, for you. Up to you. Okay.
Thank you, ma'am. Thank you. Am I audible?
Yes, Dr. Sudhakar, you can go ahead. You're audible.
Yes.
Very good
Now
afternoon,
you are
one and all. Very good afternoon, one and all. This is Dr. Sudhakar, Associate Professor from the Department of Anatomy. On behalf of Organizing Committee, BMS Con 2021, I welcome our Chief Guest, Dr. Girija Shivakumar, and Chairpersons, Dr. Shanti and Dr. Ravi Shankar, to the last session of third day scientific talk. I welcome you all, other participants also. Now, before that, I would like to introduce our chairperson, Dr. Shanti. Dr. Shanti is currently working as a professor and head of the Department of Anatomy, United Missions Kribananda Varya Medical College and Hospital. Madam completed his MBBS degree in Kilpack Medical College under Dr. MGR Medical University, and also completed MD in 2008 in Stanley Medical College under MGR Medical University. Under awards and recognitions, Madam holds various positions in various bodies and executive editor in National Journal of Basic Medical Science and member in Research Advisory Committee, and also Department IQAC coordinator since 2015 onwards, and resource person in MEU since 2017, and convener Internal Compliance Committee between 2018 to 2020, also MEU coordinator since 2020, then convener Curriculum Committee since 2020, also life member in Society for Basic Medical Sciences, also founder member in Society of Clinical Anatomists, also life member in Association of Anatomists, Tamil Nadu and Pondicherry, also life member in Anatomical Society of India. Madam has also published 12 publications in both national as well as international journals, and also published book in the name of Practical and Applied Histology by that EMMS Medical Publishers 2015. I welcome you, ma'am.
Thank you, sir, for your warm words.
Thank you. Next, I would like to introduce next chairperson, Dr. Ravi Shankar. Dr. P. Ravi Shankar, Professor of Anatomy from SRM Dental College and Hospital, Ramapuram, Chennai. Sir has completed MSc in Anatomy from Dr. A.L. M. Postgraduate Institute of Basic Medical Science, University of Madras, Chennai, and also completed PhD in Neuroanatomy, Department of Anatomy from Dr. A.L. M. Postgraduate Institute of Basic Medical Sciences, University of Madras, Chennai. Under awards and recognitions, Sir completed his fellowship, Tamil Nadu Junior Research Fellowship from 7th July 2001 to 11th August 2003, Department of Anatomy from Dr. A.L.M. University of Madras, Taramani, Chennai. Sir is also received a Dr. Jayavelu Memorial Award for the best paper presentation for the postgraduate in the FLEX Annual Conference of Association of Anatomists. Apart from that, Sir also holds life member in International Society for Neurochemistry, life member in International Placental Stem Cell Society, and life member in Indian Association of Biomedical Science, life member in Society for Neurochemistry, India, life member in Association of Anatomists, Tamil Nadu, life member in Anatomical Society of India, also life member in Indian Academy of Neuroscience. Sir is also published 8 international journals at batch. Welcome you, sir. Now, I would like to request our chairpersons to introduce our guest speaker, Dr. Girija Shivakumar. Over to you, ma'am.
Good afternoon to everybody. Is I am audible, sir?
Yes, sir.
Okay. Very good afternoon to everybody. It is my great pleasure to be a chairperson for a eminent Professor Dr. Girija Shivakumar. First of all, I would like to thank the entire team, particularly Dr. P. Rajan, giving me an opportunity to be to chair the scientific session and BMSc e-conference. Madam, she has qualified MSc anatomy as well as PhD in hematology, and also she has done her diploma course, postgraduate diploma in counseling in psychology, and also she has completed MBA, Master of Business Administration, Hospital as well as Healthcare Management, and also a Premier Fellowship for Fidel Via. Awards and recognition of her. She was having head of the department. She was head of the Department of Dental Wing in the Karnataka Vinayaka Institute of Medical Sciences and Research Center, and also course coordinator under the Medical Education Unit from 2009 to 2015, and member secretary of Institutional Animal Ethical Committee, and also members of various academic coordination and student mentor and program coordinator for various institutional programs, and member of institutional research report, and also alumni association faculty in charge in her research faculty, research source faculty for various e-learning programs, particularly conducted in Department of Anatomy from Chettinad Medical College and Research Center, and also she has delivered a guest or invited speaker in various conferences, such as the 42nd Annual Conference of Association of Anatomists, Tamil Nadu. It was conducted by the Medical College, Salem, and also she has delivered the guest lecture at Vanavani Vidyalaya Higher Secondary School. It is present in the IIT campus, Chennai, and also Indian Society of Dental Research, Mumbai, and also e-learning on Camtasia, as I mentioned earlier, in the Chettinad Health City, and also she has conducted continuing medical education program under the Department of Orthopedics, Katapanoga Institute of Medical Sciences Research Center, and also she delivered the speech in national roundtable conference. It was held at Pune, India, and also the panel member for 39th annual conference of Association of Anatomists, Chennai, Tamil Nadu, and also she was working at the Devaraj Medical College and acted as a medical educationist in the Department of the Anatomy, and also she has presented various papers in an international forum such as in USA, Myanmar, Japan, China, as well as in Mauritius. Okay, now presently, various positions she has held as a president of Association of Anatomists Tamil Nadu from 2010 to 2011, and also from 2017 to 2018. And also she was a president of Society of Biological Scientists of India from 2013 to 2014. And also she is a recognized PhD guide from Texila American University, and also recognized PhD guide from the Tamil Nadu Dr. MGR Medical University. She is very expertise in conducting workshops in medical education technologies and faculty development program. She has published more than 25 international national indexed journals in various journals. Credit. Now I hand over to Dr. Shanti Madam to take over the session. Ma'am?
Good morning. Am I audible?
Yes, yes.
Yes, ma'am. Yes, ma'am. You are audible.
Good morning. Good morning, everyone. Really, it's a great opportunity offered by AVMC and Rajan sir to us, and to chair Madam's session. With the broad introduction, I can understand she has a very length and stretches journey in the field of medical education. And apart from her academic as well as administrative responsibilities, now Madam has done FAMER also. I like your spirit, Madam. And I don't know how Madam is balancing both all these things, and always carries a smile on her face. She never showed the stress. I really appreciate you, ma'am. And as you all know very well, we are now in the phase of implementing CBME from 2019. And we are expecting the students to achieve the level of Bloom, the top level of Bloom's pyramid. We may not able to achieve this goal if we still follow the teacher-centered learning methodology. So it's a need for us to move from teacher-centered learning to student-centered learning. What Madam is going to enlighten us on the concept mapping, a newer technique for medical students in learning basic sciences in the era of CBME, ensures the quality of learner-centered teaching or learning methodology, and also assures the student can retain their basic science knowledge so that they can easily correlate their basic science knowledge towards the clinical aspects, and also able to perform better in their career in future. With these few words, now I welcome and I am pleased to invite you, ma'am, to enlighten us on the topic today. Definitely, we all know very well, Madam is a very good orator. So it is going to be a fruitful session for all of us. With these warm words, I welcome you, ma'am, once again to enlighten us. It's over to you, ma'am, now.
Thank you so much, Shanti, ma'am, for your words of encouraging. And encouragement can happen at any age, at any stage in one's life. And with those encouraging words only, we can build up our activities or our career or our growth, whatever it is. So thank you so much. I'm so overwhelmed with your words and with the words of Dr. Ravi Shankar. And my extended thanks to Dr. Sudhakar. He's a very well-known friend of mine. Thank you, Dr. Sudhakar.
Thank you, ma'am. Thank you so much, ma'am. It's my pleasure
Yeah.
to have you as a guest speaker.
Yeah, I'm so happy to meet
Yes,
you
ma'am.
all here on this platform, and I'm so happy to deliver a topic on which is very, very sensitive and also an important one from the perspective of the students, of medical students. Once we have started off with this competency-based medical education, and we all know how much we are struggling to implement this CBME. But from the student side, what type of efforts to be done, we all have no idea about that, or probably maybe we are all guiding them how to compete with the subjects taught for them, and how to correlate this so-called integration, alignment, all those things and all. So this session will definitely give a helping hand to the students as well as to the teachers, the medical teachers, to guide them, to take on them into the road of preparing towards the CBME subject content. With these words, can I share my screen now?
Yes, ma'am.
Yeah, is my screen visible?
Yes, ma'am. Kindly
thank
change
you, Dr.
into
Sudhakar.
presentation mode.
Yeah, I'm doing it. Is it okay, fine?
Yes, ma'am. Fine, ma'am.
Thank you, Dr. Sudhakar. So with this introduction of what we expect, what we are going to expect in this session is to guide the students and to help them, facilitate them to prepare the subject content towards the application of knowledge to reach the higher levels of Bloom's taxonomy. So one such helping technique is the concept mapping. We all are familiar with this concept mapping, and we all know we are all guiding the students also towards acquiring the knowledge. But still, if we have some guidance with some tips and techniques, definitely it will help all of us in creating a concept map and helping the students to develop a concept map through this session. So with these introductory words, let us get into the session with a quote by Dr. Sudhi Back, who said, "Be curious always, for knowledge will never acquire you. You must acquire knowledge." All the academic activities are based on the knowledge what we are acquiring or gaining, and the skills what we are acquiring by experiential learning. So a knowledge is a factual or a procedure that helps one to attain the higher levels in their career or the academics. The knowledge is a combined result of the learning or the experience or the training of a person who undergo some training program or an academic program. The major elements of knowledge, if you see, we call it as a concepts. The concepts are nothing but the smaller fragments of the content which are built up into the blocks, and those blocks are nothing but the ideas or the thoughts or the principles or the definitions or the consistency, whatever it is. All these concepts, they all join together and they form the knowledge, the foundation for the knowledge. In a nutshell, to define the concept is a perceived irregularities in the events or the objects or the record of events or the objects designated by a label. So at the end of the session, we expect the participants to enlist the principles and types of concept mapping, how to construct a concept map, how to apply the concept map in comprehending their deep learning, and how to use a concept map in problem solving. So what is a concept map? Why we need a concept map? And how to construct a concept map? And when to use a concept map? This is the whole idea behind the session. So now what is a concept map? A concept map is a visual illustration that displays the concepts or the ideas in an organized manner, in an organized pattern, denoting the relationship between each item, which is said by Hoffman and Novak. Many a times we all would have seen the detective stories or the movies, or even in forensic department, we would have studied about how the detectives, they detect the cases, solve the cases. So they used to make some sticks on a wall and they'll put some pins in it and they will tie it with the ropes. So these are all nothing but the concept map, the principle behind the concept map. This is to show what are all the basic things hidden in the particular case and how they can be spotted and when they can be spotted and how they can be linked to one another. That is the thing behind the deductions or the detective stories. The same thing we are going to apply with a concept map in the terms of the academic performance or academic knowledge acquisition. The concept maps are the two-dimensional diagrams that shows a relationship between two items, or that relationship can be in a hierarchical manner. It consists of a number of labels, number of relationships, the number of connections, and the directions of each item. A concept map has an information in a sequential manner, or the techniques which are to be remembered in a stepwise manner, and they contain the items which are arranged in an orderly manner. And this concept map will help to interpret the incoming informations of the brain, put it into a meaningful ideas. And this concept map will help us to promote critical thinking in a problem solving aspect. When it comes to the concept map, when we can use this one? We can use the concept map to organize the information or to put the informations into a systematic way or in a hierarchical manner so that we can understand in a better aspect or in a better way about one particular topic. And it will help us to simplify the understanding of the complicated concepts. Now, getting into the making of concept mapping, how we can draw a concept mapping or how we can design a concept mapping. So what do we need to prepare a concept map to start with? We need to have some color papers, or a white paper is also do good, with the color pens or the color sketches or the crayons, whatever it is available. The colors are mainly we choose because the colors, the visibility of the colors are more attractive and more memorizable than you write it in your plain pen or a plain pencil. This is a simple psychology. And of course, we need to have some standard textbooks and the hand notes taken by students. What a concept map it contains? A concept map contains a key node, which is said to be the main topic. It has got a subnode, lines, labelings, and arrowheads. So the key node is the main topic. The subnodes are the subtopics. And we have some lines connecting this main node and the subnode, which we call them, which we mark it with the labeling. And these lines can be a one-sided arrow or a double-sided arrow. The one-sided arrow will show from the main item to the sub-item, and the double-sided arrow will indicate there is an interrelationship between the two items. So now we know what is a concept map and what does it contain, the main components of the concept map. Now, what are all the types of concept map we can construct? The concept maps are of different types. One, we call them a spider map, a hierarchical map, flowchart map, a system map, and of course a bubble map. So we'll just see one by one what does it contain and how we can use the particular concept map. Spider map. A spider map will closely resemble a spider which has got a web and the limbs. So the main spider will have the main body of the content or the main topic. Let me just take a pointer. So here we have the main concept of the particular topic. From there, we draw the lines, what we call them the links. And at the end of the links, we will have the subnodes or the subtopics. So here, if you want, you can write down the labeling, or just if it is going to have a branching of the main topic, just we can put the line and the arrows and we can take it on to the next item. So if we see what are all the advantages of the particular the spider map, we have the advantages. The spider map is very easy to draw. It is very easy to understand and memorize, and it will have the data in an organized manner. The only problem with the spider map is the data, they cannot be interrelated to each other. And if you want to make some complex or a complicated concept map or a data, it will have a messy spider, or the web will become a very messy one. So here we have an example of a spider map. So you make it a main concept, the human body, which can be divided into different aspects. And in turn, each aspect will have its own subdivisions. This is a simple spider map. So next comes the chronological or the hierarchical map. This hierarchical map, again, it has got a main concept. It has a main concept, and from where we divide it into the branches, and they will have sub branches. The only thing is these will have an arrow, but they cannot be a reversible arrow because it's a hierarchical. Either it can be drawn from a higher order to a lower order, or from a lower order to a higher order. As an example, the chronological map, an example for the chronological map, we can use for the arteries and the veins. So for the arteries, we can draw a flow chart or this hierarchical chart from the main concept towards the terminal branches. And for a vein, we can draw from the terminal veins into a main vein. So this chronological order can be in a higher order or a lower order, in an ascending order or a descending order. But we can't make a reverse order in this chronological flow chart, means a map. The advantages of this chronological map is it is very definitive in pattern, and it starts from a general data to a specific data. And the disadvantages, as I mentioned, we cannot interrelate the data between each other. And this will not help us in doing any problem solving or a critical thinking. Just it can help you for a rote memory. Example of this is the nervous system. As I mentioned earlier, even we can use it for an artery or a vein. So this is an example for a chronological or a hierarchical flow chart. Means the concept map. And next, coming to the flow chart. The flow chart is a one which can have different directions. It will have labelings, and this chart will have the two arrows also. So this flow chart can help us in deriving a concept or arranging the concepts in different directions, not like a chronological chart or like a spider's chart. This flow chart can be made into a very crystal clear map with different directions of arrows connecting, showing the relationship between the main topic with the subtopics. So the advantages of this, it is easy to prepare and read. It will help us to organize the concepts or the ideas in a logical manner. And it can also to some extent help us for clinical problems also. The main disadvantages, we can represent the data only in a very minimal pack. And it can help to have a critical thinking, but not to a greater higher order thinking. Like you cannot develop a concept. Only we can just solve a problem, or we can just have a critical thinking of the clinical condition, what is given in the particular topic. But it cannot have a solution or a map for a complicated things. An example for a clear flow chart.
the anti-epileptic drugs. The anti-epileptic drugs can be classified into these types, and under these types you can have another classification also, and simultaneously you can draw down from the drug. For example, succinimide is there. You can draw down another flow chart asking for the contraindications or the combinations or pharmacokinetics. Like this, you can just keep on doing the flow chart. So the flow chart will help us in different directions, but in an orderly manner. We cannot go like a spider chart, how it goes in a half-a-sort manner. So here is an example of the next mapping, what is called as the system map. A system map is a one which constructs or which can be constructed in a systematic way, and it can be drawn in different directions. It can be drawn in two-way directions also, and the lines connecting the two different items can have the labeling, like it undergoes a process, it degenerates, or it disintegrates. Like that, we can have the labeling on the arrows. So this is a system map which helps us to complete one particular topic. It will help us to have or represent the interrelationship between the data. It will help us to a greater extent in a critical thinking and a problem solving. The difference between the flow chart and the system chart is the flow chart will have one definitive pattern which can give solution for the smaller or the simpler critical problems, whereas this system chart will help us to a greater extent in solving complicated cases also. That means this system chart can be widely used in phase phase 3 and phase 4 medical graduates. The disadvantage of the system chart is it's highly time consuming. It's very complex and complicated to prepare as well as to understand, because it's going to contain too many informations. But once you prepare this system chart, and you will never forget the items that are placed inside the system chart. This is one example of a system chart where the main node is the respiratory drugs, and it has got so many other sub nodes or the sub items, under which again there are so many other subheadings under which we can write some points in it. The difference between the system chart and the other charts, if you see, you can give a few lines of explanation in the system chart, which will help you to remember about one particular term. Whereas in the other charts, we can just name or give only one name of the item, and we can't give an explanation on that one. So this system chart is the major one which can be highly utilized for the purpose of the problem solving and the critical, and to promote the critical thinking. And this one is the newest one called as the bubble chart, which is easy to construct, which is easy to remember, easy to recollect also while you're reproducing your knowledge. So this is an example for a bubble chart in which we have given a classification of wounds. So this chart, mainly the students can use it for their small questions during examination. Means like in many universities are doing with the 2-mark and the 3-mark questions and all. For these type of questions, the students can use this bubble chart. So these are all the types of charts that students can construct, and medical teachers can guide the students in making or preparing this concept charts or concept maps. Fine. We have got now a broad idea about what are all the types of charts or what are all the types of concept maps we can construct. How to prepare a construction, how to construct a concept map. We know the types. and how to construct a map. This is what we need to know. The construction of a concept map has got 6 stages. One is called brainstorming, then organizing, a layout, linking, revising, and finalizing. So what is brainstorm? The concept map can be constructed with a very high quality when it is done by a group of people or a team of people. It can be students or it can be faculties also. How to make the brainstorming? First, you make the team, then you give the main topic to them and ask them to split it into fragments. Now the main topic will be there, and for the main topic, what and all is needed, it has to be given in a subtopics or the smaller segments or fragments. Now we have to keep everything ready. And those subheadings or the subtopics or the subnotes or the fragments, it can be written in a one word or in phrases, depending on what type of chart you want to prepare. And second one, organizing. The second step is the organizing. You have to arrange these fragments on a table. First, pick out the main topic and arrange the other subtopics in different places. And now we have to decide in what sequential manner or in what manner you want to have these subtopics. So arrange these items according to the map what you are planning to decide. When we do like this, we will come to know what and all we have given extra information and what are all the informations we are missed out. So based on that, you can either add or you can either delete the information. Now arrange these items around the main topic. And now you plan for the relationship or interrelationship between the main topic and the items. And now bring in the arrows. You either want a single arrow or you want a double-headed arrow. Place these arrows close to these items. Then you fix up from which direction or in which direction you want to put these arrows. Now this is arranging. And now we are putting these arrows in a definitive manner, definitive pattern. And these arrow lines will specify the relationship between the items or interrelationship between the items. We can use from one item to other items either as a single arrow or a multiple arrows also. And now, after finalizing the entire map, first we have to examine carefully whether all the items and the main topic has been arranged in a proper way in which we would like to prepare the concept map. And just look into the map whether it is understandable and applicable also. And wherever you feel like there is some messy things which is not needed actually in the particular part, just remove it and make it simplified. And the main most important thing in preparing a concept map is using different colors. When you use a main concept, use one color. When you use write down the sub notes, use different colors. From the sub notes, if you are going to give some other sub branches, give different colors and use a different color for the arrows. For unidirectional arrows, one color, and bidirectional arrows, another color. While using these colors, definitely the concept map, it becomes very, very beneficial one and easy to remember also. And now you finalize the arrangement of the items. That gives you a better understanding and that it has come out in the way what you expected, and you just see to it whether you are satisfied with the concept map what you have prepared. And finally, stick this concept map on either a whiteboard or on the wall, which is a place you just keep on moving frequently. So what is the use of concept map? So we know what are all the types of concept map and what are all the steps involved in the concept map and how to prepare a concept map. Fine, we have done everything. We have prepared the concept map. We have stuck it on the wall. And how we are going to use that concept map? See, the concept map, mainly it can start off from the lecture classes. As we the medical teachers, we have to first inculcate the culture or the habit of making this concept notes in the classroom. So this making of concept map can start off from the classroom. And you make the students understand it is very easy while taking down the notes during lecture classes. Rather writing down, instead of writing in big sentences, you can train the students to make the concept map in the very beginning of the academic year itself. And you just make sure that they understand the concept map first. So you need to have, maybe we can have one small half-an-hour session also in our foundation course, so that they will have a good brainstorming session about the concept map. So this concept map will help the teachers in planning their lectures while taking the small notes for preparing for the lecture class. It will help us to make the notes in a concept map manner. Of course, definitely it is helpful for the researchers, the carriers, and for those who organize the conference and the workshops. This concept map is very, very impressive. And in my belief, 80% of the memory, it comes from the visual. So definitely this concept map will have a very greater impact in the memorization of the various concepts and the other academic things what the students are expected to remember. Definitely this concept map will help them, the students, in promoting their critical thinking. What is the benefit for the students? It will improve their clarity of thoughts. It will help them to accumulate more of information, and in turn, it will help them in acquiring their knowledge. It will help them to achieve a deeper learning and understanding of a particular subject. It will help their memory, improve in their memorization and the coherence or relating the concepts, and it will enhance their clarity of relating to different concepts or the problems. How it can be useful for the teacher community? It can be used as an educational tool for preparing the lecture classes as well as facilitating the students in preparing their notes for the subject understanding. It can be used as an effective tool during a formative assessment to assess their deep learning and the critical thinking. And we are all started doing the formative assessment, or you can put it in other word like a continuous assessment. So like a class assessment, we can give this as an assessment. You can use this as an assessment tool to evaluate the students' understanding of the subject. This concept map, it can help to promote students' active participation in a large group interactive learning. And what are all the advantages of the concept mapping? If we see, it is easy to use. It will help to improve the deep learning. It promotes the critical thinking and ability to understand the problems, and it influences the knowledge construction. And the limitations, if you see, definitely it is a time consuming. The more complicated the concept map you construct, the more it becomes messy and difficult to understand. And there are some limitations in using the keywords for the complex concepts, which would sometimes mislead to another understanding. So the system map only has a provision of writing down some bigger phrases also in it, but again, it will become more complex and complicated. And of course, the concept mapping, the more you go higher in the complexity, the more it becomes time consuming. And how to overcome the limitations? We should have a regular practice of doing the concept mapping so that you can reduce the time consumption While constructing a complex map, you can split it into 2 or 3 fragments and you make it into a simple construction. Means when you make a bigger topic, you split into smaller parallel topics, and under that you can construct the sub concept maps or 2 or 3 concept maps clubbed together. So this will be easy for understanding as well as to prepare the concept map, as well as it will help to apply the concept map in understanding the complicated problems. Definitely, using the different colors will make our concept map more impressive and attractive, and of course it will have a very good visual memory. So the end of the session, we have a take-home message for the students to practice concept mapping. Change your rote memory to an understanding memory. Apply the concept map into a critical thinking and problem solving. For the faculties, encourage the students and guide the students in making the concept map, and use the concept map as an assessment tool during your formative assessment. So any questions?
Thank you, ma'am. It was really wonderful presentation. I think
thank you, Dr. Sudhakar.
There is no queries in the chat box. I think you have clearly explained all the topic.
Sir?
Yes, sir. Yes, sir.
Actually, Madam presently is working as a professor of anatomy at Anna Medical College and Hospital in Mauritius. To her, there were some questions here.
Yes, sir. Yes, sir.
Dr. Pawan, he has posted, ma'am, what will be the difference in graduate attributes and program outcomes of any one program? One second, read. There is a few queries in the chart box. Dr. Pawan has posted, ma'am, what will be the difference in graduate attributes and program outcome for any one of the program? Ma'am, are you able to hear, ma'am?
Ravi Shankar,
yes,
this question is not my session. It is a previous session question.
Yes, ma'am. Actually, this is
not the present session question. It's a previous session question.
not. Yes, ma'am. As you said, it is not related to this session.
Yes.
Oh, okay.
Sir, I would like to add one point about this question, sir. The difference between graduate attributes and program outcomes for any one program. Graduate attributes, actually the program, VBS, that is the program, no, sir. Course will be the phases. And graduate attributes at the end of UG session, what they are going to attribute, that how they are going to become a graduate medical, that what we are expecting, that goal we are actually CBME described very well. They have a clinician like that, lifelong learner, communicator, leader, team worker like that. But the program outcome is more or less similar to that, what we expect them, but it includes their knowledge as well as attitude and skills. And we have to derive the program outcomes based on the objectives. For each and competency, what you're expecting them to perform. For that objectives, you have to bring one outcome. So it will be running in parallel, sir.
Okay.
I hope you got it, sir.
Yes.
Thank you, sir.
Ma'am, it is a nice presentation. Because due to technical issues, during the introduction, my screen was blurred, so I could not do perfectly. Anyway, I hope I have done my job. Thank you very much, sir.
Thank you, sir.
Here water is there in my ground floor. Very heavy rain. Due to heavy rain, yesterday I conveyed my inconvenience. In spite of that, I will start the session. I hope.
Okay. No problem, sir. No problem.
Thank you, sir. For being with us, sir. Ma'am, there is a question for you, ma'am, from my side. First, I would like to thank Madam for her
Yes, ma'am.
extensive, elaborate, and crystal clear presentation, ma'am. You explained clearly about how we can utilize the concept mapping in perspective of students as well as teachers. And I actually wonder no initially how you are balancing. Now I got the answer. I think you are using concept mapping to balance your academic, administrative, as well as family life. Ma'am, the question here for you is actually, you told that for assessment, we can use concept mapping. Even the exams, they can write concept mapping, like bubble map you told, ma'am. Is there any method to evaluate how to give score, give marks, ma'am, for that? If the student write in the form of concept mapping, how we can give marks?
Actually, the concept map for the assessment part, you can use the simple maps, not the complicated one we can use. Only the simple maps, the bubble maps or the simple flow charts we can use. For example, secretor motor pathway for the parotid gland. In earlier days, the students used to do just a rote memory and they just simply write whatever was given in the textbook, entire thing they'll be writing. And now here you can guide the students, train the students in writing it in a flowchart manner. How to write the secretor motor pathway? Because nowadays we are giving them only 3 marks for a short answer. Hello, am I audible, ma'am?
Yes, ma'am. Yes, ma'am. Please, ma'am.
Yes. So for the 3-mark question, how much we expect from the students? So if you train them for this flowchart, maybe the secretor motor pathway can be used in a flowchart manner. So you can just start off from the brain, put an arrow mark, then the cranial nerve, then where does it end? Then put an arrow mark, put an arrow nerve, then come to the ganglia. From the ganglia, put an arrow mark. So when they complete this flowchart, the entire thing is understood. The entire secretor motor pathway of the parotid gland will come. So finish it off. So this you can assess. It is easy for you also to assess the students. It is easy for the students also to put it on the paper.
Yes, ma'am. Definitely, students will save a lot of time if they write in this format, and we also expect them to write here. So for 2-mark question, easy 3 marks. If they write everything, we can give the whole marks to them.
That's all. Yes, ma'am. So you will have the model key answer also.
Yes,
What are all the things you items to be there in the answer? Definitely, you will be having a key answer only this.
Okay.
So instead of writing it into a sentence format, they put it into a flowchart manner.
Okay, well said, ma'am. Are there any rubrics, ma'am, for this, for evaluating concept mapping?
Rubrics means concept mapping. Whatever the rubrics you are designing, you can make use of it. The rubrics means like rubrics in a simple map, we cannot make use of it. Only it is a definitive pattern. So you can just simply make it into a key answer and we can evaluate it. You will have the marking pattern, no?
Okay, ma'am.
So based on that marking pattern, you can fix up the rubrics.
Okay, ma'am. Thank you, ma'am. Thank you for your answers. Really had a good time with this session. So I'd like to thank once again AVMC team and Dr. Rajan sir, Dr. Ravi Shankar sir for being with us. And Girija madam, really, it's after I'm seeing you after a long time, we met in that at camp. It's nice to see you, ma'am, here. Any other participants, if you would like to ask any questions, please come forward.
I think no more queries from the participant side, ma'am. Okay.
Thank you, ma'am, once again.
Thank you. Thank you,
Thank
Dr.
you.
Thank you, Girija ma'am.
Thank you. Thank you, Dr. Sudhakar.
Thank you, ma'am. Thank you so much.
Very happy to see you on this platform.
Thank you, ma'am.
Ma'am, Dr. Rajan here, ma'am. Girija, ma'am.
Yeah, sir.
Sir.
Sir, thank you, sir.
Thank you so much, ma'am.
Thank you.
Thank you, sir. Thank you so much. My special thanks to your university and your college. And of course, my special sincere thanks to Rajan sir and Dr. Shanti ma'am and Ravi Shankar. Of course, all the speakers and the delegates. It's a wonderful platform you have given me, sir. Thank you so much.
Thank you.
Yes, ma'am. Ma'am, for token of appreciations, you honor you. Ma'am, please
Thank
stop
you.
your screen, ma'am.
Yes.
Sharing.
Yes.
Right. Right. Yes, ma'am. On behalf of organizing team, PMS COM 21, we would honor ma'am for sharing your valuable knowledge with us.
Thank you.
Thank you, ma'am. We also like to honor the chairperson, Dr. K.C. Shanti ma'am, as a chairperson.
Thank you, sir.
Thank you, ma'am. We also like to honor Dr. P. Ravishankar sir for chairing the session. Okay, ma'am. Once again, thank you, Dr. Girija ma'am and the chairperson, Dr. Shanti ma'am and Ravishankar sir for just joining us and make this session is successful. Thank you so much, ma'am. Thank you so much, sir. Shall I conclude it?
Thank you.
Thank you,
Yes.
Sudhakar.
Dr.
Sir,
Sudhakar, you can
yes,
conclude.
sir.
Yeah, now actually there's a photo session is there. So all
Yes,
the
sir.
delegates will be joining as a panelist now. So
Okay, sir.
we'll have a photo sessions once in a 15 members like that. They take a photo sessions. Okay. And
Okay,
yeah.
sir.
We are sending request to each and every attendee.
Okay, sir.
Please accept that request. We request you to please accept the request. All attendees,
Dear delegates, kindly accept the panelist pop-up message will be coming on your screen so that you will become panelist here. Then only it's possible to make a group photo sessions. Tell your delegates not possible. Please come into the Zoom link what I shared and just see in the screen. The team will be sending you the pop-up message of join as a panelist. Once you join panelist, they'll send you group photos. Thank you all.
Okay, sir. Thank you, sir.
You stop sharing, sir.
Okay, sir.
Dear delegates, please keep your smile for 5 to 10 minutes because they'll be taking a screen wise. Okay, so first screen, second screen, like that, keep moving. So bottom with us. So keep smiling for 5 to 10 minutes. And please open your video. The photo session is not for the profile pictures, it's for the live pictures.
Sir, we will let you know once we are going to click the pictures.
Yeah, yes, sir. Yes, sir. Okay, please inform us, sir. You can, you can make a countdown also. Okay, good.
Yeah. There are many people who are still declining to accept that request. So, don't know, but we are keep on trying. We are keep on trying.
Yes, sir. We'll give for them 5 minutes time or 1 or 2 minutes time.
Yes.
Okay. Whoever accept will do that, sir.
Yes. After 5 minutes, we will take. Yeah.
After 1 minute enough, sir. We need to keep more time also. 1 minute's time is will give. Okay, thank you. Shall we start, sir?
Sir, one more minute because many
Okay.
people are raising hand right now.
Okay, right,
So
sir.
we
Right,
are
sir.
allowing them.
Okay, right, sir.
Good morning.
Sir, 52 people, 53 people are there now as a panelist. So let's take pictures for them. Right, sir?
Yes, sir. So these people can leave, then we can move the other people also.
Yes, yes. So
So
please
shall we
smile,
start?
everyone.
Excuse me, sir. Can we leave?
Yeah, one second. Sir, shall them leave, sir? This group over?
Yes, sir.
Okay.
Yes, please.
Thank you all. You can leave. Now the other panelists, other group, you taken photograph. Thank you all for joining with us photo session. Thank you, ma'am.
Thank you, sir. Thank you once again.
We will be sharing the photos in the group. Those who are in the previous group, kindly leave. It will occupy the,
Dr. Rajan, please check the pictures in the group which we have shared.
Yeah, 1 second, sir. Yes, sir, that's good.
Okay, sir. Fine.
Shall we make for this group, sir? Shall we tell them to open the camera? Some more to join.
Some more to join, actually.
Yeah.
Let's wait for 1 minute. Sir.
Yes, sir. Yes, sir. Yeah. Hi, Senthil Kumar, sir. Senthil Kumar, sir.
Hi, sir.
How are you, sir?
Fine, sir. Fine, sir.
Yes, sir. I think this group is filled now, sir. Shall we tell them to?
Yes, sir.
Dear delegates, please open your camera and smile for few seconds. There are so many not open their camera. This group photo is not for the profile picture. This is for the live pictures. Please, Dr. Bini, Shilpa. Many are there. Please, dear delegates, are you able to hear us? The group photo session is not for profile pictures. Only name is there. Please cooperate with us so we can go to the next team, next batch. Okay, sir. Shall we start? Pankaj, sir?
Yes, please smile, everyone.
Yeah, please.
Done, sir. Done.
Yes, sir, I think or not. Okay. Some of them opening now only, sir. We'll give them a few second time.
Please take again.
Okay, sir. Thank you all for joining with us photo session. So you can leave. We'll go to other batch. Thank you all.
Thank you, sir.
For this batch, it's over. Please leave the session. You can go for this oral presentation. Please leave. Whoever finished, please leave. This batch is over.
So shall I also leave, sir?
You can leave, sir. You can start that work. Other work.
That's what.
Yes,
Okay.
Somebody should coordinate here. That time, yeah.
Thank you, sir.
Yeah. Okay, sir. Now we are for the new group. Whoever finished, please leave. Mahendran, hi. Still at the college?
Hi, sir. Yes, sir.
Okay. Sir, this page is filled now. Shall we tell them to open their camera? Please open your camera so that we can see you.
Sir, there are many people are coming.
Okay, let them come. So for this team, we can finish up now. So this batch. So over here, please, all of you, please open your camera. The group photo is not for profile pictures or name.
Everyone, please open your camera.
Many have not opened.
Yeah.
Amruta, Sushmita, Shilpa ma'am, you please, Chellapan, please open your camera. Otherwise, there is no point of no. Please open your
camera. Dear delegates, please open your camera.
Now they are opening. Dear delegates, please open your camera and keep smiling on your face.
We are taking a group photo actually.
Sir, 13697. You are coming in all the time, sir. We have to give a chance to everybody, no? Yes. Amrita ma'am. Okay, sir. I think we can start. Keep smiling.
Okay, smile, everyone.
Done, sir?
Done, sir. Done.
Okay. Thank you all. You can leave the session. You can go for the scientific presentation.
Thank you, sir.
Yeah, thank you. We'll move to the other one. Parveen ma'am, I think yours over, ma'am. You can leave. Parveen ma'am. Sajan, Shilpa ma'am, please open your camera. Amruta Varshni. Shilpa ma'am, please open your camera. Yeah, dear delegates, please open your camera. Then only you can. It's possible to have a group session photo. Nonam Chellappan. I think yours is over. Sheetal, can you open your camera? Susita, can you open your camera? Yeah, so shall we start, sir?
Yes, sir. Please smile.
Yeah, keep smiling.
Done, sir. Done.
Thank you, sir. Dear delegates, please leave the group. Dear delegates, please open your camera. Ma'am, Shilpa ma'am and Susmita ma'am, you are all there for a long time, but not opening the camera. And no, and we are. So for this team, we are taken, no? This team is over. Yeah. Except Deepa, madam, remaining all can leave. Except Deepa, madam, Deepa, I think, and also Jyoti, ma'am. I think for remaining all we have finished. Amrita, we have finished yours.
Sir, not finished yet, sir.
I'll share you the photo, madam. I have the photo here. I'll share you.
Sir, we still have UG session, sir. UG presentation session.
No, you have to go for that link. This is only group session.
This is a different link. Okay.
You join there. This is a photo
Okay.
session.
Okay. Thank you, sir. Thank you.
Perumal sir, we finished yours. You can leave, sir. Your photo session is over, sir. Yeah. Now the new team has come. Yeah. All of you kindly smile. Please open your camera. Open your camera. So these two, Pankaj sir.
Yes, sir.
Is it possible to the Sushmita and Sheetal? They are there, but not opening the camera also. And they are there for all times. They are occupying the other.
Shall we remove them?
Yeah, that can be done, sir.
Yeah.
333 and Dr. Sheetal, no? And Nonam Chellappan also. Perumal sir, you can leave. Perumal sir also you can remove, sir. Yeah. Yeah. So please, yeah. It's good, sir. Now you can take a photo, sir. Please keep smiling for a few seconds. You can adjust your
face. We are
face.
ready. Please smile.
Yeah. Please smile. Done, sir?
Yes, sir. Done.
Okay. Thank you all. You can leave now. We are going for other team now. Please leave. Please leave. Those who have finished, please leave. Sir, yeah. So now the other team has come.
Please open your cameras. Dear
Dear
delegates.
delegates, kindly open your camera so we can see you. Sir, for you have taken a photo, sir. Pharmacology explained simply. You have taken a photo, sir. You can leave. Yeah. You can leave, sir. We have taken a photo. Yeah. I think now only few are there, sir. Anybody else is joining, sir? Rajan, sir, you can open your camera, sir.
Yeah, I'll do it, sir. Yes.
Okay, sir. It's a group session.
Am I visible, sir?
Yes, Paul, sir?
Yes, sir. Yes, sir.
Yeah, you are visible, sir. Now, the Pankaj Kaushal and Sunita, they have to open their camera. Nonam Chellappan, you are not even opening your camera, but there for all the time. Rajan, sir, you are opening your camera?
I'm just trying, sir. Yeah.
Okay, okay. Bhavna, ma'am, please open your camera, ma'am. Roshan, please open your camera. Dear delegates, please open your camera. Roshan, please open your camera. Yeah, please. I think Elraj sir only not opened. Sir, shall we go with them now? This team, we can take a photo,
Yes,
sir.
yes, sir.
Yeah, it's good.
Please smile, everyone,
Keep smiling.
and hold your mobile or laptop.
Done, sir. Done.
Sir, Nonam Chellappan, madam, that time only removed her mask. Put one more screenshot, sir.
Okay, one more.
Sir, please listen. I am Smita Jiraj. Don't.
Oh, why it's showing like Nonam Chellappan when you are coming here? Okay,
Smita
right.
Jiraj. Smita Jiraj.
Okay. We can identify only by that name, no matter what is seen to us.
Okay.
You can adjust yourself to your camera.
Okay.
Yeah, now one more screenshot, sir. Smile, please. Done, sir?
Yes, sir.
Thank you all. You can leave now. You can leave now.
Sir, I have renamed myself.
Ma'am? Yeah, I finished it. I finished yours. Sangeeta. I finished.
Yes, sir.
Thank you so much,
finished.
sir.
Sunita finished. Sangeeta finished. Yeah, sir, but sir, for you also finished, sir. You can leave, sir.
So for me, you're taken, sir.
No, sir, you are not open. No, you are not open your camera. Now open your camera, sir.
Salary is open.
No, we are not able to see you, sir.
Is it?
Yeah.
Salary is open.
But you are not seen. Hello?
So what about now, sir?
No, you are not visible.
Okay, then forget, sir. It's not.
Dear delegates, please open your cameras. Yeah.
Sir, Elrajan, sir.
Yes, sir.
Your profile picture only is there.
Pardon?
Your profile picture only is there.
This one is not opening. The camera is on, actually.
Okay, then come with the other one, sir. Anyway, we are going with another 5 minutes. It will be there. You come with another camera. Yeah, Kalpana, ma'am, only giving a proper force. This is what we are expecting from everybody. Right. So you take now. Jaikala, ma'am. Jaikala Shivashankar. You are not opened your camera, ma'am. You want to have the group photo session? Yeah, good. Okay, sir, you can start now.
Actually, I opened my camera, but the front camera is not working well. This one selfie.
You have to turn, sir.
Now, sir.
No. Anyway, we'll see in the next batch, sir. Now we are finishing this batch. Sir, you are starting for this batch? Pankaj, sir?
Yes, sir. Yes.
Done now? No, starting now. Keep smiling, please. Smile, please.
Done, sir.
Done. Thank you all. Sarath, sir, Jayakala, ma'am, and Kalpa, ma'am, you can leave, ma'am. You can leave this session. You can go for the parallel scientific presentation. We are going with the other one now. Kalpana, ma'am, you can leave. Manisha, ma'am.
Yeah.
Yeah, there now. You can open your photo, ma'am. Camera, ma'am. Please open your camera. Manisha Simka also there. Manisha. Both. Yeah. Please open your camera. Yeah, both are there. And I think, yeah. Okay, sir, everyone, sir, you are there now, but
Visibility.
Yeah.
Front camera is clear.
Okay. Yes, sir. Yes, sir. For this team, you can do, sir. Okay, sir. Batmashri, ma'am, please open your camera.
Okay. Yeah, we are taking picture now. Please smile, everyone. Please remove your mask, ma'am.
Ma'am, Batmashri, ma'am, remove your mask, ma'am. You want to have a mask? Batmashri, ma'am, remove your mask.
Yeah. Okay.
Yeah, right. Okay. That's good. Please, sir, you can go ahead now.
Okay, please smile, everyone.
Smile, please.
Done.
Thank you all. You can leave now. Okay. Manisha, ma'am, both Manisha. Batmashri, ma'am. Parveen, ma'am. Parveen, madam, you can leave. Manisha, ma'am. Both Manisha, ma'am, you can leave. We are taken. Elrajan, sir, you can leave. Elrajan, sir, we have taken our photo. Please leave, sir. You can leave the session, sir. There's a parallel session going on. You can go there. Arvind, ma'am, you have finished your photo, ma'am. Batmashini, ma'am, yours is over. Kumar, sir, good afternoon, sir. How are you, sir?
Sir, thank you so much.
Thank you, sir. Sir, but your camera is, it appears to be like a negative, you know?
Okay, I'll just see, sir.
Yeah.
Please remove the backdrop.
Background you remove. Yes, sir. Yes, sir. Thank you for joining with us now, sir. Pankaj, sir.
Yes, sir.
I think only few will be there. We'll finish off. Thank you so much for your cooperation, sir.
Okay, ji. Thank you very much. Thank you, sir.
Rajan, sir, you can leave, sir. Yours is over. You leave the session, sir. Or can you please remove, sir? Pankaj, sir.
Shall we close the meeting?
No. There are some people are coming, sir. But I think Rajan, sir, can be taken. Yeah. Raghapriya, ma'am, wait for a few seconds, ma'am. We'll wait for other people to join. Dr. Pallavi, ma'am, please open your camera, ma'am. Raghapriya, ma'am, please join with us. Yes, ma'am. Pallavi, ma'am. Dr. Pallavi, please open your camera, ma'am. Yeah. So 3 are here, sir. Shall we go, sir? Sridevi, ma'am, open your camera. Sridevi. Sridevi, please open your camera. Yeah, good. Shall we go, sir, now?
Yes, sir. Please smile, everyone.
Smile, please.
Done, sir.
Okay, thank you, sir. You can leave. Ragapriya ma'am, Sridevi ma'am, you can leave, ma'am. Pallavi ma'am, please leave. You can go for the parallel scientific session, ma'am. Good, sir. Now it's everything good. Yes, sir. Pallavi ma'am, yours is over. You can leave the session, ma'am. Sridevi ma'am, yours is over. Okay. Sir, anybody joining?
We are sending request. We are sending them request.
Okay. Now you can take both of us, sir. Sir is our resource person. We two are here.
Okay,
you please
sir.
take
Okay.
this photo. Smile, please, sir.
Done, sir.
Thank you, sir, for joining with us and gracing the occasions all the ways. Thank you, sir. Yes, sir. Please. Ravi Shankar, sir, your camera, it appears very dark.
Too dark. Please switch on the light.
No power.
Okay, come out of the house, sir.
This system is very. Okay, sir. Now that water is draining.
Okay.
Somehow from the ground floor getting down to first. Sorry, sir. Because due to the circumstances only, I
no issues, sir.
Okay.
No issues, sir.
If I was in the department, definitely. It
Okay. Yes, sir.
Right. Good manner. I can.
Okay. No issues, sir. No issues, sir.
Sir, actually, for the presentation, YRS award presentation, now today.
Can you call me, sir? Sir, will you call me, sir? Plus, now the participants are waiting here. You call me by phone, sir.
Okay, sir. Okay, sir.
Okay. Sir, I think nobody joining. Shall we end the session?
No one is joining now.
Okay. We'll end the session, sir. Thank you, sir. Thank you, Pankaj and the team, Girish, sir. I think someone is joining. Anuj Jain is joining. Anuj Jain, Dr. Anuj Jain, please open your camera.
Good afternoon, sir.
Dr. Karampreet, please open your camera.
Shika Singh, please open your camera. Shika Singh, please open your camera. Hello, do you hear me?
Yes.
Shikam, you could able to see only your profile pictures. Okay, sir, you finish with this, Anuj, sir, and.
Okay, sir. Please smile. Yeah.
Please smile.
Ready.
Done, sir.
Done. Done, sir.
Thank you all. You can leave now. Karampreet Kaur ma'am and Anuj Singh, sir. Thank you, sir.
Thank you, sir.
Yes, sir. You can leave now, sir. Shika Singh, ma'am, you open your camera, ma'am, and mute yourself, ma'am. Anu sir, we finished yours. And you can leave, sir. You can leave this session. You can go for the parallel scientific presentation session. Ma'am, Karam Prith, ma'am, you also can leave. Sir, any more attendees are there? These attendees are not joining, sir.
Yeah, they are not joining actually.
You have given the request to
Yes,
them.
yes, multiple times.
Okay. Dear attendees, Suman ma'am, Tyagarajan sir, Ranjit, you can accept the panelist pop-up message. Sophia, Lakshmi, I think. Yeah, Suman madam is coming. Kirti ma'am, you can accept the Suman Yadav and Lakshmi Di. Please accept our panelist Kirti, Vaishali, Atrika, Bharati, Dr. Bharati. You all can accept. Please see on your screen. That's a request for a panelist. Please accept that. Saumya, Artika, Sai, Rekha, Mangala Narayan, Vaishali, Atrika. Atrika, please open your camera. Mangala Narayan also can open your camera. Please open your camera. All of you, please open your camera. Then only you can take a group photo. So shall we finish off this batch?
Yes, sir.
Please smile. Mangala Narayan, Sri Sikar, not open the camera.
Done, sir.
Done. Okay, you all can leave now. Suman ma'am, Atrika, and Sushmita ma'am, you can leave. You can leave the session. You can go for the parallel session. Kirti, Jayapriya, you all want to have the group session? Or we leave the sessions? I think they are not. Mangal Narayan, Ashmita, Janani, Jayapriya, you are all there? I think they may not be joining, sir. We'll leave them. Okay. We'll end the session, sir.
Okay, sir.
Sir.
Okay, sir.
Thank you, sir. Thank you so much. And after the conference and validity function, I'll be in touch with you, sir.
Okay.
Thank you so much for the past 3 days support in a short time. You have given a wonderful job for us, sir.
Thank you, sir.
Yeah, we'll continue our relationship all times.
Sure, sir. Sure, sir.
Thank you, sir. Thank you
It's
so
our
much.
pleasure. It's our pleasure, sir.
Yes, sir. Thank you, sir. Thank you so much.
Thank you, sir. Bye.
I leave the session, sir.
Okay. Ma'am, your picture is done, ma'am. You may leave. Dr. Mangla. Thank you, ma'am.